Hi, Chairman Cox. I see you just joined the meeting. If you'd like to do a quick AV check before we get started, that'd be great. Thank you.
Hey, can you hear me okay?
Yep, you're all set. Thank you. And then
Good.
Supervisor Gaspar or your office, I see that you've joined too. If you could do a quick check for us. If there's anybody from Supervisor Gaspar's office that's on right now, if you'd like to do a quick AV check for us before we get started, please.
Andrew, ready to go?
Chairman Cox, we are ready when you are.
Very good. I'll declare this Tuesday, July 7th, 2020 meeting of the San Diego County Board of Supervisors called to order. We certainly hope everybody had an enjoyable 4th of July weekend, although we realize it was probably a lot different than previous 4th of Julys. But in order to get this meeting going, I'd ask the clerk to please call the roll.
Thank you, Chairman Cox. Before I call the roll, I would like to note for the record that all 5 supervisors are participating via teleconference. As such, all votes will be handled by a roll call vote. Additionally, before we begin, any members of the public that wish to provide oral testimony during today's meeting, please review the instructions posted on the Clerk of the Board's webpage. I will remind members of the public that have requested to speak to wait to dial in to the meeting until the item is called. With that, I will now call the roll. Supervisor Jacob?
Here.
Supervisor Gaspar? Supervisor Fletcher?
Here.
Vice Chairman Desmond?
Here.
Chairman Cox?
Here. With that, we will go ahead and start our meeting with the invocation. Today, we're honored to have with us Rabbi Scott Meltzer from the Or Shalom Synagogue to lead us in prayer. Rabbi, if you'd please take over.
Thank you so much. Source of all, you are called healer. At this time of seemingly immeasurable illness, this time when we are stricken with a novel disease of the body, this time when we are stricken with an old disease of our collective body, our society, We acknowledge that in the book of Psalms, you are called the one who brings forth bread from the earth. And I've traveled, but I've never seen a bread farm. You bring forth bread from the earth in partnership with the help of farmers and millers, bakers and grocers, truck drivers and cashiers, and all the others who aid you in this work. As you bring forth bread, so too you heal. You are the healer of bodies with the help of nurses and doctors, techs and aides and ambulance drivers and researchers, the aid of all those who social distance and wear masks, with the aid of this august body, our County Board of Supervisors. And you are the healer of our collective society, with the help of all who would stand up for justice, who lend their voice, their pen, their time, all who teach, all who march for what matters, all those who lead, the members of this august body, our County Board of Supervisors. Eternal One, you are the healer of individuals and of society. Please may you be aided in your work of healing by this, our County Board of Supervisors, these men and women who serve in this government by the people, of the people, and for the people. With your guidance and inspiration, may they, through wisdom and goodness, help to heal and protect all who are ill, help to heal and protect all who are suffering from illness of the body, of injustice in our society. And may healing come speedily to all who are suffering. And let us say, Amen.
Thank you very much, Rabbi Meltzer, for that very inspiring invocation. And again, we thank you and your congregation at Or Shalom Synagogue for allowing you to be with us this morning.
Thank you.
Our Pledge of Allegiance this morning is going to be led by our Vice Chair, Jim Desmond. So if you would please stand for the Pledge of Allegiance.
All right. If everyone please stand, join me in the Pledge of Allegiance. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Vice Chairman. And we will proceed into the presentation or announcements of proclamations and awards. And this morning, I'm really honored to present a proclamation to April Fenton Hines, who is a longtime county employee who is retiring after 13 years of dedicated service to the County of San Diego. I believe April is going to come up to the lectern in the chambers, and Helen Robbins-Meyer will actually present her with a proclamation. But if you'll bear with me, I would be honored to basically acknowledge what is included in that proclamation. April Fenton Hines has faithfully and diligently served the County of San Diego for 13 years, having been essential in keeping this county and its facilities running. As the Director of General Services, April has successfully overseen the development and delivery of our major county infrastructure, including winning 3 Orchid Awards for the County Operations Center, the Waterfront Park, and the Fallbrook Library. April has developed a strategic approach to replacing and renewing the county's aged infrastructure, leading to the implementation of the invaluable annual capital improvement needs assessment to guide the county capital development. April in 2015 received the CAO's Excellence Award in Leadership for demonstrating the county's values of integrity and stewardship in managing over $1 billion in capital projects, spearheading new environmental sustainability efforts, and achieving one of the top 5 fleet organizations in the nation. As the executive sponsor of the county's LGBTQ employee resource group and the county's diversity and inclusion initiative, April has championed a culture of inclusiveness and equality. In 2016, April was promoted to Deputy Chief Administrative Officer and General Manager of the Community Services Group, where she led the departments of animal services, County Library, general services, purchasing, and contracting in the Registrar of Voters with integrity and purpose. As Deputy Chief Administrative Officer for Special Project, April was instrumental in identifying surplus property to meet the housing needs of people experiencing homelessness, locations for asylum seekers in our county, and manage shelter needs during the county's response to the COVID-19 pandemic. April Fenton Hines leaves behind a legacy of dedication, excellence, leadership, respect, and authenticity that made all who worked with her and for her grateful to have known her throughout her career here at the County of San Diego. For all of these reasons, and on behalf of all my colleagues on the Board of Supervisors, we wanted to take the time today to commend April Fenton Hines for her distinguished service to the County of San Diego and the people of San Diego County, and we do hereby declare this day to be April Fenton Hines Day throughout San Diego County. April, on behalf of all my colleagues on the Board of Supervisors, we want to thank you for a job well done. You certainly have earned your retirement, and we certainly appreciate everything you've done for us. Then we'll give April an opportunity to say anything she wants to say without any repercussions.
I want to thank everyone, including the Board of Supervisors, for all the support you've given me throughout the years. None of this would be possible, of course, without the leadership, guidance, and funding, most especially, to be able to create all those things that you just listed off. When I first came to the county, I knew it was in my wheelhouse to do the kind of job you needed to have done, but I had no idea that the camaraderie and support of all of my fellow department heads, general managers, and CAO's office, along with the Board of Supervisors, would make it such a fulfilling and lifelong dream to actually be able to give back to my community in an organization that was dedicated to the mission of the public good. After a career in the military, I knew what it was like to be in a mission-driven organization, and I was pleasantly surprised to find that same attitude here within the county, and the camaraderie and the dedication of the professionals here is equivalent to no other that I've ever encountered. So I want to thank all of you, my fellow department heads, general managers, and all of the leadership team here in the county especially, for making this career worthwhile. And I will miss you all tremendously, but I will look forward to not getting up at 5:30 every morning to join you in this and watching from afar. So I thank you all for this wonderful proclamation. Just culminates what I already knew about the county and the way you treat people and the way you're driven to do the job you do for the county every day. So thank you very much.
Well, once again, April, we thank you for your service, and we certainly wish you the best on your retirement. You certainly have earned it. Our second proclamation this morning is going to be presented by Supervisor Nathan Fletcher, and this will be presented to honor Dr. Rodney G. Hood. Supervisor Fletcher.
Thank you, Chairman Cox. Even as we see a resurgence in the number of positive COVID cases in the last few weeks, we continue to see disproportionate impacts of coronavirus across the board. These disproportionate impacts hit hardest our underserved community, those who are least likely to have access to healthcare, and who are most likely to have chronic underlying health conditions. As we see our COVID numbers peak in South Bay and Southeast San Diego, we see the consequences of inequities in our healthcare system that have been there well before the emergence of coronavirus. But on the front lines of tackling these issues and dedicating a lifetime to ensuring equity is Dr. Rodney Hood. Dr. Rodney Hood has worked in Southeast San Diego to confront inequities head on and create improved health outcomes for underserved communities in San Diego, particularly communities of color. He's worked to increase access to healthcare and treatment. Dr. Hood co-founded and became president of the Multicultural Medical Group, an independent physician association consisting of over 150 primary care physicians, 200 specialists, all focused on providing quality healthcare to underserved communities. After 40 years in medical practice in Southeast San Diego, Dr. Hood increased the scope of his outreach by merging his medical practice with San Ysidro Health Centers. After years of service as president of the local San Diego National Medical Association affiliate, he was elected the 101st president of the National Medical Association. Over the past 3 decades, Dr. Hood has researched and lectured extensively on the historic aspects of race and racism in medicine and its impact on today's health inequities. In addition to his service on multiple boards, Dr. Hood's most recent project has been spearheading the COVID-19 Equity Task Force, a group of dedicated health experts in San Diego County who took early action to try and address the disproportionate impacts of COVID-19 on communities of color. Dr. Hood has reached out to our office frequently with concrete and very thoughtful solutions about what we can do to build lasting change in our community, to improve healthcare access for all, to build more sustained, equitable path to recovery from the coronavirus pandemic. Thanks to his efforts, expertise, and advocacy, we're working together and have created the Regional COVID-19 Task Force for Equitable Recovery to ensure that we are pushing for fair and just recovery for people of color and underserved communities in San Diego County. I am incredibly grateful to have someone like Dr. Rodney Hood in our community. What he does, his tireless work, his advocacy, the grace and compassion about which he goes about his daily life is a tremendous benefit to all. And so in recognition of his incredible career, his tireless advocacy efforts, his clinical expertise, and all that we know he will continue to do, it's my pleasure to present this proclamation declaring the 7th day of July 2020 to be Dr. Rodney G. Hood Day throughout San Diego County. And I would now like to invite my friend, Dr. Hood, to say a few words.
Thank you, Supervisor Nathan Fletcher, and to the entire Board of Supervisors. Your leadership in addressing the health equity issues caused by COVID-19 has been extraordinary and certainly noticed by the citizens of District 4 as well as the entire county. I must say the creation of COVID Equity Task Force was not accomplished by my efforts alone, but required the help of my executive team that included Dr. Susan Afalo, Dr. Robert Gillespie, Mr. Reese Jarrett, Ms. Regina Evans Jarrett, Minister Waliullah Muhammad, and Kevin Liu. Our advocacy for testing and equity access for the most underserved citizens of San Diego County was not only successful due to the cooperation and leadership from the Department of Health and Human Services that included Nick Machione and Wilma Wooten, but many citizens of San Diego County. Under the leadership of Dr. Wooten, early phases of this pandemic in San Diego County saw the initial flattening of the curve. However, we are now witnessing spikes in the incidence of disease that is disproportionately affecting Latinx, Black, and Asian communities. All of the members of the COVID-19 Equity Task Force want to congratulate Dr. Wooten for her courage, professionalism, and leadership in attempting to curtail this most recent resurgence of the virus. To be successful, Dr. Wooten will not only require the COVID Equity Task Force continued support, but the citizens of San Diego County must continue to support her efforts, and the Board of Supervisors must ensure her safety on and off the job. Any public comments expressed that are threatening or intimidating just cannot be allowed. To show our commitment for the leadership of Dr. Wooten, a letter of support has been submitted from the members of the COVID Equity Task Force, the Multicultural Health Foundation, the San Diego chapter of the National Medical Association, as well as other concerned citizens of the county. We pledge our continued support and expect that our Chief Public Health Officer will have the full support of the entire Board of Supervisors while she is doing her job, making difficult but necessary decisions that will lessen the impact of disease and save lives. So again, I am are honored, humbled, and appreciate this honor, not only recognizing me, but my executive team and all members of the task force who continue to support our efforts. Thank you so much.
Well, thank you, Dr. Hood. And again, we sincerely thank you for all the leadership that you're providing and certainly very supportive of the efforts to make sure that we have an equitable and a fair way that we deal with this whole COVID-19 pandemic that we're dealing with. The next item on our agenda is public communications. At this time, we welcome comments from the public that are on items which are not on today's agenda. It's my understanding we have 9 public communication emails that have been received prior to the beginning of this meeting. And I'll ask the clerk of the board to go ahead and read those into the record.
Thank you, Mr. Chairman. The first non-agenda comment is from Kenny Gwynn. It reads, I would like to beg the City Council to don't defund the police. Defunding the police is the wrong answer to solve this problem. Please do not give in like LA and New York. We must provide better training for the police, specifically martial arts, how to calm an angry person, make police participate in community like Cahoots program in Oregon. We must make police take psychological tests every 3 months to make sure they're fine. Please don't defund the police. The second comment is from Ian McFarland. It reads, good morning, County Board of Supervisors. On June 3rd, 2020, a background report and proposal for additional DEH services was submitted. As previously mentioned, recovery options will offset negative fiscal impacts. However, if support can be provided by August, there is an opportunity to significantly reduce costs. Please reply as soon as possible with how to best proceed. The next comment is from Rianne Tsai. It reads, my landlady sent a notification for a rent increase. I'd like to know how come the issue of rent increases has not been addressed, especially since there is an eviction moratorium. I know I am not the only one in this situation. I don't have a job. How can I afford a rent increase if I can barely pay for the rent as it was? Please help. The next comment is from Crystal Grobner. Reads, good morning, County Board of Supervisors. I am concerned about illegal marijuana dispensaries around unincorporated areas of San Diego County. They've become abundant in recent months and closer than ever to elementary schools in Lakeside. On June 24th, a few of the illegal dispensaries in El Cajon and Lakeside were raided by police. Most seem to have reopened, some the very next day. What can be done to keep our communities free from illegal drug activities in broad daylight? Thank you. Next comment is from Mary Smart. It reads, the San Diego Union Tribune published an article recently indicating that the Sheriff's Department is considering outsourcing medical services. I see no reason to believe that this will solve the problem of mass death in our county jails. The humane answer here is decarceration. Please allow people to safely quarantine at home during this pandemic. The next comment is from Jessica Webb. It reads, please consider opening up a discussion on the growing number of unlicensed marijuana dispensaries and the plethora of vape shops throughout Lakeside. While I understand there is a true benefit to medical marijuana for some patients, there is also a relationship between drugs and crime, as well as neighborhood character that needs to be considered for all members of the community. Please start addressing this growing problem before it becomes an unmanageable situation. Thank you. The next comment is from Michelle Krug. It reads, I have expressed my concern to the county's ADA compliance officer about blind people and those without a computer being unable to access the county's COVID press conferences back in March. To this date, I have heard nothing from Todd Hood, ADA coordinator for the county. I'm eternally grateful to Nathan Fletcher's office, where Nick Zinter immediately made it accessible for me. The county, unlike the city of San Diego, has not created a telephonic solution for everyone else who needs it. The next comment is from Roberto Alcantar. Reads, as a proud member of the Invest in San Diego Families Coalition, the Chicano Federation believes the county's budget must be created through an equity and racial justice lens. The road to recovery must be just and equitable. Essential workers at low income levels continue to be impacted at much higher rates by COVID-19. Racial disparities in healthcare, policing, and incarceration, and who holds essential jobs are among the factors that make people of color more vulnerable in this pandemic. The last comment is from Cleveland Joyner. It reads, I would like to know if permanent restroom will be built in the park and ride lot at Highway 76 and Old Highway 395 near I-15 Greenway in Fallbrook. This area is next to a gas station, Circle K, that utilizes porta potties, and they are disgusting. This park and ride also includes electric vehicle charging stations that are used daily. Also, long-haul truckers frequent this lot to sleep. Area has 3 new construction communities being built called Horse Creek Ridge, Meadowood, and Aurora Heights. The remaining e-comments posted under non-agenda public communication were related to items on today's agenda. Those comments have been distributed to the board and filed with the appropriate agenda items. That concludes non-agenda public communication, Mr. Chairman.
Thank you, Mr. Potter. And again, all those e-comments that we received will be automatically referred to staff for follow-up. So we thank you for your input. Move on to the next item on the agenda, which is the approval of the statement of proceedings and the minutes for the regular meeting of June 23rd, 2020, and the in-home supportive services public authority meeting of April 21st, 2020, and June 23rd, 2020. Is there a motion for approval?
Move approval. Second.
We have a motion by Supervisor Jacob, seconded by Supervisor Gaspar. Is there any discussion? Hearing none, would the clerk please call the roll?
Thank you. Chairman Cox,
Aye.
Supervisor Jacob,
Aye.
Supervisor Gaspar,
Aye.
Supervisor Fletcher,
Fletcher, aye.
Vice Chairman Desmond.
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
We will proceed on to the formation of the consent calendar. All items on the agenda will be considered a part of the consent calendar unless there's a desire on the part of the public or members of the board to pull items for further discussion. Would the clerk please identify those items that have been pulled by the public?
Thank you, Mr. Chairman. Item 2 has been pulled by the public. That item will be heard concurrently with item 5, which has also been pulled by the public. Item 4 has been pulled by the public. Item 8 has been pulled by the public. Item 11 was noted as a presentation item on the agenda, but there are no requests to speak on this item, so this item may be approved on consent. Item 12 has been pulled by the public. Item 17 is being pulled for comments by Deputy Chief Administrative Officer and Chief Financial Officer Tracy Sandoval. Item 23 on the regular agenda and item 1 on the County of San Diego Sanitation District are closed session matters that will be considered at the conclusion of the board's public session. I'll note for the record that item 2 on the in-home supportive services public authority authorizes execution of a revised employment agreement, including salary and benefits between the public authority and its executive director, with the statement that item may be approved on consent. All the remaining items on the in-home supportive services public authority may be placed on the consent calendar for your board's consideration.
Very good. Let me proceed now to my colleagues, starting with Supervisor Jacob. Do you have any comments or additional items to pull?
Thank you, Mr. Chairman. No additional items to pull, no comments, and I would move approval of the consent agenda.
Okay, thank you very much. We'll move on to Supervisor Gaspar.
Thank you, Chairman. I have no additional comments. I'll second the consent calendar.
Okay, moving on to Supervisor Fletcher.
Thank you. I don't have any items to pull. I'd like to make brief comments on item number 11. That's around Mount Etna. The need for affordable and accessible housing in San Diego County is vital, and the need to put it in appropriate places is foundational to our ability to make any substantive progress on tackling the housing crisis we face. Today, we take another critical step forward to providing housing right in the middle of District 4. Over the past few years, this board started prioritizing housing through the creation of the Innovative Housing Trust Fund and through a review of county-owned properties for potential development. And I think this is a positive step forward, and those previous actions have now put us in a place where we can continue to move forward with things like this site, Mount Etna Drive in Claremont, county-owned land, former crime lab, was identified as a piece of land best suited for housing development. It is ideal for it because it has proximity to bus lines, transit upgrades, medical offices, shops, and services. Chelsea Investment Corporation is our development partner, and the project will be 100% affordable. It'll have 164 senior units, 240 family units for a total of 404 units. In addition to the seniors and families, an additional 30 to 50 units will be reserved for the developmentally disabled. This property is designed to be an intergenerational community and will include an open to the public senior center on site. I think this is a wonderful project and a good example of the type of thing that is possible to build housing, construct housing, provide you put it in the right place and you do it the right way. And so I'm pleased to see this continue to move forward.
Thank you, Supervisor. We'll move on now to Vice Chair Jim Desmond.
Thank you, Mr. Chair, and I have no items to pull. However, I just do want to make a brief comment on item number 1. I know this is, we heard this item on June 2nd, and today we're adopting the resolution, but it's such a great thing, I think, for San Diego County. I just want to thank LAFCO staff and our fire authority and the public safety group for their continued progress on establishing the San Diego County Fire Protection District. It's, just ahead of the fire season. the task to bring about more meaningful change to enhance our public safety and firefighting capabilities in the unincorporated area is almost complete. Again, I want to appreciate Supervisor Jacobs' leadership on this and the staff work that has gone into making this a reality. I want to say thank you to Holly and to Herman and Chief Meacham and the rest of the team for making this a reality. Thank you.
Thank you, Supervisor. I have no additional items to pull, but I do have a brief comment on item number 7, which is to approve the Aging and Independent Services Area Plan for fiscal year 2020 through 24 and authorize the agency director or designee to sign and submit subsequent area plan documents and required by the California Department of Aging. This area plan we have was conducted in January through community forums and completed with feedback. None of us could have ever foreseen the COVID-19 pandemic affecting the nation the way that it has. Because of the high number of vulnerable seniors in my district, I think it's important for us to move forward with some consideration about the long-term impacts of this pandemic. Low-income seniors in my district have struggled with housing and food insecurity, as well as basic access to transportation and other resources. I imagine COVID-19 has certainly made those problems even worse. I would like us to begin assessing the long-term impact of COVID-19 that may worsen the conditions for these seniors and gather feedback from them like we did for the area plan. This feedback is important because we will have to tailor our level of service to meet this need over time. If we are unable to adjust our area plan or add an addendum to at this point, I still would like to see this assessment completed countywide and reported back to the board. Thank you. Those are the comments that we have. So let me ask the clerk to go ahead and identify those items that we'll be voting on the consent calendar.
Thank you, Mr. Chairman. The following items have been pulled for discussion. Item 2, item 4, item 5. Again, items 2 and 5 will be heard concurrently. Item 8, item 12, and item 17. Item 23 on the regular agenda and item 1 on the County of San Diego Sanitation District or closed session matters will be considered at the conclusion of the board's public session. All the remaining items on the board's regular agenda, as well as in-home supportive services public authority, are on the consent calendar.
Very good. And we do have a motion from Supervisor Jacobs, seconded by Supervisor Gaspar, to approve the consent calendar. If there is no further discussion, would the clerk please call the roll?
Thank you, Chairman Cox.
Aye.
Supervisor Jacob.
Aye.
Supervisor Gaspar.
Aye.
Supervisor Fletcher.
Fletcher, aye.
Vice Chairman Desmond.
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
Very good. We have a number of speakers, particularly on item number 4. I think the last count that I saw, it's somewhere in the neighborhood of 50 speakers in regards to item 4. What we're going to plan on doing this morning is to go ahead and first hear items 2 and 5, and then we'll hear item 4. If we do not wrap up the agenda by 12 noon, what we will do is take a break from 12 to 1 o'clock. Board of Supervisors will meet in closed session from 1 to 2 p.m., and then we will reconvene at 2 p.m. for the balance of the items on the agenda. So we'll be able to better tell whether we can get through the agenda this morning a little bit later. But anyway, that would be the normal course of action. And if we can complete all the items before the 12 noon break, then we will not need to reconvene as a board except for closed session. So with that, we'll proceed on to a presentation by our staff on item number 2 and number 5. Item 2 is the authority to contract with and accept funding from the Department of State Hospitals for a felony mental health diversion program. And item 5 is to receive the update on the advancing the behavioral health continuum of care through regional collaboration and innovation. And I know our staff does have a presentation, so we'll go ahead and ask the staff to start with that at this time.
Mr. Chairman, before we begin the presentation, I would like to remind any members of the public that have requested to speak on this item, please dial into the conference line now using the instructions that were provided to you, and you will be muted until it is your turn to speak.
Good morning, Chairman Cox and members of the board. The Public Safety Group and Health and Human Services Agency remain committed to working with local partners to address the complex mental health and substance use disorder needs of our community. Today, we will be presenting on items 2 and 5. Rachel Saul will speak to the mental health diversion program, and Dr. Luke Bergen will provide an update on the behavioral health continuum of care. At this time, I'll turn it to Dr. Luke Bergen, Director of Behavioral Health Services.
Thanks, Dean. As we will discuss later this morning during the COVID update, recent data has indicated trends in population-level mental health and shifts in service utilization associated with the COVID-19 pandemic that compel us to respond. The overarching goal of our continuum of care efforts remains the same: to achieve a transformational shift from a model of care driven by crises to one driven by chronic or continuous care and prevention. But with the COVID-19 pandemic, the care and service landscape has changed dramatically, and this calls for adjustments to our strategic and tactical approaches. First, based on recent economic trends, we anticipate our funding sources will be adversely impacted. We'll have fewer financial resources with which to drive change, and we need to think about different kinds of and differently sized investments. Second, federal and state regulatory authorities have enabled the rapid expansion of innovative ways of working, such as telehealth, that may increase the reach of current services by providing access to care in patients' homes and community settings. Third, uncertainty about the future epidemiology of COVID-19 and potential surges in hospital bed need for COVID-19 care directs us toward an approach in the immediate term that is less dependent upon devotion of hospital system resources. In the near term, therefore, we're putting on hold large capital investments in hospital infrastructure, which have been key tactics in our continuum work, and are instead focusing on investments that yield more immediate impacts on maintaining hospital availability for COVID response while keeping people connected to behavioral health care and while extending our reach to the many people not currently getting care that they need. To do this, we'll be focusing on either end of the continuum: on diversionary services that keep people out of acute care on the front end, and on long-term care and support on the back end. We'll continue our focus on coordinating care across clinical and non-clinical settings. Much of what we'll be presenting today has been in motion since the board conference of 2018. In future updates to your board, we'll be discussing initiatives that have been developed specifically to address COVID-related needs and dynamics around behavioral health. Much of this is being supported through $15 million in CARES Act funding, which has been allocated to support telehealth infrastructure and other COVID-related response. The future update will have the same framework that we emphasized today, but with additional attention paid to ensuring that there are equitable and judiciously designed services across the county's varied and diverse demographics. Reflecting the important intersection of public health and public safety, we think of diversionary services as those that keep people out of avoidable, expensive healthcare, and also as services that help people avoid unnecessary involvement in the criminal justice system. Single contacts with these services may often have positive impacts on both fronts. Last March, your board approved a recommendation to establish a regional mental health crisis stabilization units, or CSUs, that provide 24/7 walk-in and law enforcement transported services for those in behavioral health crisis. Driven by the urgency of need, our initial focus has been on North County. Though it has met repeated delays owing to community siting resistance, the North Coastal community-based CSU in Vista is progressing. The provider, Exodus, is in contact with the Vista City Planning Department, and planning for necessary tenant improvements is already underway. We anticipate operations commencing as early as late fall. The North Coastal Live Well Health Center community-based CSU in Oceanside continues to move forward with construction, expected to commence by the end of 2020. Meanwhile, your board approved actions on May 19th to expand the hospital-based CSU at Palomar Hospital. This includes a move into a new facility that is adjacent to the ED and increasing the size of the service from 8 to 16 recliners. We are happy to report that the ribbon cutting went really well last week and services commenced July 2nd. Palomar CSU will be up to full capacity by the end of this calendar year. The most recent efforts on this front are in the South region, where a hospital-based CSU has moved through program design phases, which will result in recommended actions that will be presented to this board in the near future. Approved by your board in June of 2019, the establishment of a non-law enforcement mobile crisis response team pilot was set for procurement and then met delays owing to community siting issues mentioned above and highlighted at the last meeting of your board. With additional attention being paid and a call for additional resources being devoted to this service, we're making some design adjustments to expedite program implementation and anticipate that a competitive procurement will be issued for the services early in this fiscal year, enabling this program to inform the scaling of mobile crisis response teams across the county over the course of the year. A separate item, item 2, brought before your board today outlines the county's desire to launch a mental health diversion program in response to a funding opportunity put forward by the Department of State Hospitals. This work fits neatly into overall strategic emphases that I've described, and to explain it in detail, I'd like to hand it over to Rachel Soloff.
Good morning. As you know, in 2018, District Attorney Summer Steffen hosted 2 stakeholder symposiums to map when mental health issues intersect with the criminal justice system. Several recommendations came from those 2 symposiums and were documented in the Blueprint for Mental Health Reform, including enhanced de-escalation training, community-based crisis stabilization, and non-law enforcement mobile crisis response. An additional very important recommendation was to create guidelines and structure for mental health diversion that ensures public safety, as well as equal access and equitable treatment for participants. I'm excited to be here today to talk with you about the program we have created, which is item number 2 on your agenda. Before I discuss our local proposal, I want to briefly set the framework for our conversation by reviewing California's mental health diversion law. Mental health diversion, codified in Penal Code Section 1001.36, was part of a budget trailer bill that went into effect on July 1st, 2018. Distilled to its simplest terms, mental health diversion may be granted to those who have any DSM-recognized mental health diagnosis when their charges are significantly related to their mental illness. There are 3 diagnoses which are excluded from diversion: antisocial personality disorder, borderline personality disorder, and pedophilia. Certain violent offenses and certain sex offenses are statutorily excluded, and the person must be able to be safely treated in a community setting without posing an unreasonable risk of committing certain violent felonies. If an individual is granted diversion and that individual continues successfully in treatment for a period of up to 2 years, their case is dismissed and sealed. Finally, victim restitution may be ordered during the period of diversion. Since this law went into effect in July of 2018, we have had approximately 60 individuals granted mental health diversion in San Diego County for charges ranging from low-level misdemeanors to serious felonies. Generally speaking, the defense is responsible for providing and arranging for the treatment plan, and it is up to the individual judge granting diversion to supervise the participant's progress, regardless of whether that judge, defense attorney, or prosecutor have any expertise in mental health issues. Additionally, what we have seen in practice here locally is that in some cases, justice-involved individuals with financial resources are able to provide more in-depth treatment plans that someone who is uninsured or underinsured cannot provide. This has led to gaps and disparity in access to mental health diversion. This program will remedy this and increase our ability to safely divert individuals charged with higher level offenses because the program provides for structured treatment, housing, and supervision. When mental health diversion was enacted, it also came with a source of funding from the state that was to be proportioned based on a county's referrals from the criminal justice system to the state hospital. The state's funding is only available for a subset of individuals, those that are charged with felonies, and only for those with a diagnosis of schizophrenia, schizoaffective disorder, or bipolar disorder. Partners from the district attorney, behavioral health services within HHSA, the public defender, the sheriff's department, the public safety group, and the court worked together to consider many different program designs that would allow us to safely offer mental health diversion to a population with serious mental health diagnoses and felony charges. The result was an agreement that we should model diversion after our already successful behavioral health court. Behavioral health court diversion will closely parallel what we know already works from our behavioral health court. However, there will be a few slight differences. Mainly, for diversion, no guilty plea is required, and the period of diversion is up to 2 years versus 3 years probation in behavioral health court. While we hope and want all of our participants to be successful, another really nice feature about this program design is that if an individual is not successful in diversion, there can be an opportunity for that individual to transition into the traditional behavioral health court program where they can continue with their care, their treatment, and housing, and still ultimately get the benefit of a dismissal of the charges. The funding for this program will support treatment and housing for about 30 behavioral health court diversion clients at any given time over the contract period. The treatment includes, among other things, ACT-level care, wraparound services, case management, life skills, medication management, benefits assistance, and community linkages. I want to point out, however, that judges may still grant mental health diversion outside of this program, so this is not the only way individuals with mental illness can be diverted from the criminal justice system. This is just one option.
This discussion of cross-sectoral work involving healthcare and criminal justice highlights the need for more robust care coordination, for the connective tissue making the continuum whole. While progress on the flagship Central Region Behavioral Health Hub has been slow during the COVID-19 pandemic, the service and operational design of a Central Region Hub, coordinated operations at the San Diego County Psych Hospital, and development of a collaborative legal entity or joint venture offering new care coordination services continues. The latter, where costs are relatively low and potential impact on our key aims is high, has been the area of greatest focus. We've been holding meetings each week with our UCSD partners and are making progress in designing sustainable longitudinal care coordination that will improve the behavioral health issues of those with serious mental illness and that will mitigate COVID-19 risk among this vulnerable population. We hope to launch this component of our Central Region Hub, as had been the plan, within the current calendar year. Events surrounding COVID-19 have made it especially painfully clear that our first responders need additional behavioral health support. The Ryan Mitchell First Responders Program was formally launched last week and is being run by Pathways, a community services organization in San Diego. This program cuts through still stubborn stigma around behavioral health by making peer supportive services immediately accessible and by enabling those to engage clients over sufficient time to draw connections to ongoing clinical care. We'll look forward to returning to this board with additional updates on how the program is performing. While calls for additional care coordination have been long-standing, they're often followed by questions about where people with greatest need can get long-term support. We can stay connected to people, we can help them navigate, but what if there's no place to navigate to? In April 2020, your board, in partnership with the City of San Diego, established a Behavioral Health Impact Fund for capital projects to support the behavioral health continuum of care by enabling organizations to increase their capacities to provide longer-term care. The request for proposals was issued in May 2020, highlighting opportunities to develop enhanced behavioral support homes, temporary and/or transitional housing and support for people with substance use disorder, homeless populations with behavioral health services needs who are victims of commercial sexual exploitation, residential treatment services, and information technology to support telehealth, data integration, and innovation. The submission period closed on June 25th and was successful with promising proposals offered for consideration. Funds for this program are expected to be awarded early in fiscal year 2021, with services operational within 18 months. There are a couple of important updates I want to give that don't fall into the categories we've organized this presentation around, but that are still important. First, in February, your board approved a series of recommendations to support local oversight of opioid treatment programs, or OTPs, to ensure best practices are utilized and the highest quality of care is provided to those served by the county. We've made advancements in several critical areas. A county employee has been designated as the local opioid treatment authority. OTPs were directed to revise their community outreach plans to include robust engagement, events, and proactive community relations. An OTP quality data dashboard to support quality improvement is under development. And OTPs were able to shift to a take-home model of service delivery, allowing them to reduce the daily flow of clients. The LODA, Local Opioid Treatment Authority, and executive leadership at BHS have met with community groups and program leadership where issues with community clinic interface have been especially challenging and have mapped out processes for determining common metrics of success so that all parties are agreed about what improvement means and agreed about how to measure it. A second initiative, also in Oceanside, has also progressed. You'll recall that on January 14th, 2020, the board approved final agreements between the county and Tri-City for the development and operation of a 16-bed psychiatric health facility on vacant land located at the Tri-City Medical Center campus. Design of the facility has moved forward as planned, and construction of the new facility is slated for completion in late 2020. We anticipate that this structure, with its innovative and striking design, will be seen as an asset by North County residents. There's obviously a great deal going on across the behavioral health continuum of care, and there is much on the horizon with the decisions to be made about behavioral health impact fund services and procurements to go out regarding CARES Act funding designated to support behavioral health. You can see in this graphic that the projects I've mentioned fall out along an extended and aggressive timeline. As these activities continue to evolve along with the epidemiology of COVID-19 and health system and county responses, certain key items will be on hold for the immediate term. These include the North Inland Regional Behavioral Health Hub, part of a planned partnership with Palomar Health, along with behavioral health hubs planned as future partnerships with the Prime Health System in the South and East regions. The latter will involve relatively little capital expense and continues to be next in line for detailed planning. Also, while an RFI for services was completed in January for the North Inland Integrated Behavioral Health Center in Escondido, the project will require extensive investments in capital infrastructure and therefore has also been delayed, along with a separate procurement for an additional 16 crisis residential beds in North County. All of these activities are important to the transformation of our behavioral health continuum and to meeting the increasingly urgent behavioral health needs of our communities. As we continue to develop plans for optimizing diversionary, long-term, and care coordination services with an eye on re-engaging hospital partners in hub-related work in the future, we aim to make programmatic and investment decisions with health equity across race, class, gender, and geography in mind. In future updates to the board, these critical considerations will be highlighted. For the time being and for all, we remain steadfast in our mission to shift from a system of care driven by perpetual crisis toward one driven by continuous care. In support of the continuum of care activities, this presentation addresses two recommendations for your board. The first one is for item number 2, if I may speak on behalf of the Public Safety Group, to authorize the Deputy Chair, Chief Administrative Officer, Public Safety Group, to execute a contract with the Department of State Hospitals to accept funding in support of a new mental health diversion program. The second is for item 5, to receive the quarterly update on advancing the behavioral health continuum of care through regional collaboration and innovation. This concludes our presentation, subject to any questions. Thank you.
Let me ask if there are any questions on the part of the Board of Supervisors to Dr. Luke or any of the other folks that are part of this presentation. Hearing none, I do know that we have our District Attorney, Summer Steffen, that is here prepared to speak, I believe, on both item number 2 and number 5. And if she's available, we'll go ahead and call her up at this time.
Hi, good morning, Chairman Cox, and good morning, Supervisors, CAO, and Board. I'm going to focus on item number 2 this morning, as it's a new item that has not been presented to this board before. Many of the incredible items that are the number 5 item have received everyone's attention. So this is comes out of the blueprint as recommendation number 8. They're not in order of importance. And today moves that along from just a plan to an actuality. As we know, just to put it in context, Rachel Solov did an incredible job presenting the item. But as you know, we have to balance the health and compassion for those who suffer from mental illness with the safety of the public. And this is exactly the approach that is being taken here, combined with the fact that we must emphasize access to the treatment and equality of all participants. What we saw is the legislature passed the mental health diversion bill, but it did not come with funding initially. And it allowed persons that had wealth and insurance to offer the court a program for their treatment, a program that allows them to have housing and treatment. But we didn't have those same options for everyone in our county. And in the spirit and the mission to provide equal justice, we sought this funding from the state. And because of the excellent collaboration that is the hallmark of San Diego, where a concrete plan was presented, combined with the district attorney's support, the HHSA support, the courts that have been incredible in San Diego in supporting this track, and the board, everybody coming together, and the public defender, to fashion a plan that would work, and a plan that would address all three things that intersect with at least 1/3 of our criminal justice system: homelessness and mental health. And because of that, this program is fashioned to treat, to keep the community safe, to provide housing and proper supervision. And with that combination, it allows serving 30 individuals, regardless of wealth or anything else, equally in our system. We've already trained our team in this, and thankfully, Dr. Luke Bergman didn't charge us anything because we're in a budget crunch. And we were able to provide that training so that our district attorney team is ready to go in order to assess and properly balance and manage a caseload that intersects with mental health at this high level. Thank you so much for your support, and this is an exciting new adventure and step for San Diego County.
Very good. Thank you, Summer. We really appreciate your involvement in this whole issue and your leadership in particular. And I also wanted to acknowledge Rachel Solo from your office, who was a part of the last presentation also. So thank you very much.
Thank you.
Let me ask the clerk. Supervisor Desmond, you have a question?
Yeah, thank you, Mr. Chair. And I wanted to say, thank you to our staff and everybody involved. This is really a big deal. This is good. Considering that the first 3 floors of our downtown jail are serving inmates with mental health issues. I'm extremely hopeful that the felony mental health diversion program will help address the behavioral health crisis in our jails. This program will serve those who are with severe mental illness, who have pled guilty and agreed to a collaborative court process with probation and treatment. And, we've all been convinced that sitting in jail when you have schizophrenia or a bipolar disorder is not going to cure or rehabilitate someone with mental illness. Jail just sometimes exacerbates the problem. So medication, therapy, and personal responsibility coupled with probation, mandatory check-ins will go much further in rehabilitating someone with severe mental illness. So I want to commend our district attorney, Summer Steffen, Sheriff Bill Gore, our public defender, Randy Mize, our probation department, behavioral health and human services agency, public safety group for making this program a reality. This has been a long time coming. People have been working very, very hard on it. I think this is a great program moving forward. And I want to commend staff and everybody involved. This is really big. Thank you.
Mr. Vice Chair. Let me ask the clerk if we have any speakers on item number 2.
Thank you, Mr. Chairman. We had 1 request to speak in favor of item 2. That caller has not called in. We have 2 requests to speak on item 5. One of those callers is available.
All right, why don't we go ahead and take action on number 2 first. We have 2 recommendations on item 2 to authorize the Deputy Chief Administrative Officer, the Public Safety Group, to execute a contract with the Department of State Hospitals to accept funding up to $3,328,000 for the term of July 15th, 2020 through June 30th, 2023 for a pretrial felony mental health diversion program and to execute all required contract documents, including any extensions, amendments, or revisions thereto that do not materially impact either program or funding level. And then the second recommendation is to waive board policy B29. Is there a motion to approve that recommendations?
So moved, Mr. Chairman, and I would like to make some comments on item 2 and 5. I guess I can do that now, or I can wait for the speaker on 5.
Why don't you go ahead and let's deal with item 2 and we'll clear that off the deck and then we'll deal with item 5.
Yeah,
I'll second.
first I want to compliment our district attorney, Summer Steffen, and her staff. I mean, she's been the champion for what I would consider to call a very creative solution to a real serious problem that we have. And the diversion program, working collaboratively with the sheriff and the public defender, probation department, HHSA, Superior Court, to provide this treatment option. Summer, I don't know how you did it working with all of those groups and coming to a very, very significant conclusion. This is a first for San Diego County, and it is, as Supervisor Desmond indicated, this is a really big deal. So I'll be anxious, those 60 that are already a part of this program, as was indicated in the staff report, I'll be really anxious to hear how they're doing and to get a complete report. But Summer, thank you. I can't thank you enough. I mean, I consider you not only our district attorney, but our in-house psychologist, psychiatrist with your knowledge and your background in bringing the mental health issues, the behavioral health issues, and joining them with the criminal justice system. And Luke, you've also done an incredible job. And I think that gets to item number 5, and I'll wait on that. So thank you again.
Yeah, we do have a motion from Supervisor Jacob, seconded by Vice Chairman Desmond. Supervisor Desmond, did you have any additional comments?
No, thank you, Mr. Chair.
Okay, and again, I would add my compliments to Summer and her staff and the great job that they're doing. This is a great item, great news, and it's nice to see funding coming through the state of California for this program. If there is no further discussion, would the clerk please call the roll?
Thank you, Chairman Cox.
Aye.
Supervisor Jacob.
Aye.
Supervisor Gaspar.
Aye.
Supervisor Fletcher.
Aye.
Vice Chairman Desmond.
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
Very good. We'll proceed on now to item number 5, and I believe we do have at least one public speaker. The clerk will go ahead and call them at this time.
Thank you, Mr. Chairman. We have one public speaker, and we'll ask you to please state your name for the audio record, and you'll have 3 minutes to address the board.
Hi, this is Michelle Krug, and I just want to appreciate any steps that we are taking in dealing with mental health issues in a humane way through our penal system, as well as streets, on the homeless issues on the streets. And I just, the county is a safeguard for mental health, as well as our health in general. And I just appreciate every effort. And I also want to applaud Summer Steffen for her direction. Thank you very much.
Mr. Chairman, I would move approval of the item, and I have a couple of comments that I'd like to make.
Okay, go ahead, Supervisor.
I would like to thank Luke and his presentation and his team and all that have worked on this. This is an incredible accomplishment in a relatively short period of time. And every member of the board should be applauded, because every member of the board has played a part in bringing this forward. Supervisor Gaspar, she started with her conference way back when, and then in the State of the County address, I laid this out. The board took action on this. I know that Supervisor Fletcher has really worked hard on it, from the hub that it will be established there in the Hillcrest area. And Supervisor Desmond, I know, along with Supervisor Gaspar had really worked hard on the Tri-City issue to bring them to the table. But when and you, Mr. Chairman, you've led the charge and you've been a great part of this effort also. So credit goes to everybody on the board. But Luke, you've really shown us in the chart. I mean, when I looked at that chart that you showed on the screen and the milestones and the goals and where we're going, yes, it's very aggressive. It's a very aggressive timeline. But I applaud you for that and the work that you've done with your team in moving this forward. It's one thing for the board to say, hey, here's what we want to do, but it's another thing to have the staff implement in the manner in which you've done that. You've done an exemplary job, and I thank you for that.
Very good. Thank you, Supervisor. I'll go ahead and second the motion. And I just have a few comments I would like to make. I want to thank Dr. Luke Bergman and his team for the update on the status of our behavioral health continuum of care. I know we've been working on an effort to build out a state-of-the-art system, and as Supervisor Jacob rightly pointed out, I think every member of this Board of Supervisors has been involved in some component of this effort. And we want a system that connects people to the right level of service, and particularly in their own communities. The pandemic has certainly had an impact on the services we provide and community needs. Now more than ever, people need support to navigate these very tough times. I applaud the staff for being proactive and moving forward with enhancements where we can. I was especially glad to hear that we will add a crisis stabilization unit in South County. I know that was originally planned for I believe 2 or 3 years down the line, but it looks like we may have an opportunity to move that up to this fiscal year. I know South County was going to be considered later, but the enhancements that we can get now, perhaps through a very, very creative program, I think are really important. Now we can address some of the needs among our lower income communities and communities of color who are suffering from behavioral health needs at a higher rate as a result of this pandemic. Finally, thank you to our District Attorney, Summer Steffen, for supporting the rollout of the new mental health diversion program. I've always admired our local behavioral health court, and this program will help get people into the right system of care at the right time. So with that, Supervisor Desmond, did you wish to make comments?
Yes, Mr. Chair, I had a couple comments just on item 5. I wanted to thank Dr. Bergman and the team for the update. It was very timely and extremely concerning regarding the severe consequences, with the COVID-19 shutdown that has caused on the overall well-being of San Diegans on top of the homeless issues that we've had. So I'm pleased to see the continued progress in Oceanside and the Vista community-based crisis stabilization units. They're going to make a tremendous difference in how behavioral health services are delivered and available 24/7 in North County. Additionally, the Tri-City Hospital psychiatric beds in the psychiatric healthcare facility, the new one that we're funding, and the hospital-based CSU investments at Palomar Hospital, along with the North Coast Mobile Crisis Response Team, a pilot that are really going to help change behavioral health treatment in North County. As far as the MAT, the medically assisted treatment programs, I'm happy to see that our behavioral health team is collaborating with the community for further compliance and treatment results. However, we did ask when that was put in place, I think that we would have 90-day updates about the complaints that we received, the corrective actions taken, the community engagement, input and results, the network adequacy and what is needed in terms of patient capacity and the distribution, disbursement of sites. And I know COVID has happened and we haven't had those updates, but I would be interested, hopefully in the next month or two, to have an update on those MAT facilities that the communities had some strong concerns over. So I look forward to that. I know your plate is full, but this is just another thing here. But it was all very good news. Thanks for all the great hard work and for the update. Thanks.
Very good. Is there any other discussion on the part of other board members? Supervisor Gaspar, you have your hand up.
Yes, thank you, Chair. Thank you, Dr. Bergman, for another excellent presentation on the current state of our behavioral health continuum of care. Thank you to our sheriff and DA for your tireless efforts as well. Today, we do find ourselves in a complex environment to address the challenging behavioral health needs of people in our region. We know the infrastructure in North County has been dramatically reduced, and we're working aggressively and collaboratively to address the fractures in our system of care to ensure those services are available. Last week, I was pleased to attend the ribbon cutting for the brand new crisis stabilization unit located at Palomar Hospital's Escondido campus. This is a first of its kind in our region to be design built with a purpose of rehabilitation and long-term recovery as the foundation. So I'd like to acknowledge and thank our county staff who have worked diligently to ensure that we don't experience interruptions in services in our system of care. We know that the behavioral health needs of our residents are changing every day. We must remain flexible with our strategy as we will be facing a dire financial situation into the future. This work is going to take strong political will from our region's elected officials as we continue to try and cite these critical services. I remain committed to making investments upstream and taking a more prevention-based approach to the complex behavioral health needs affecting nearly every family I know, and I applaud the careful collaboration that's existed up until this point. Thank you.
Okay, is there any other discussion on this item?
Yeah, just quickly, Chairman Cox, I applaud all the work that's been done, our DA, everyone who's been a part of this. I do look forward to the continued update on timelines around the countywide mobile crisis outreach teams. We've just allocated $10 million for that program. That is a very important program that, in addition to the pilot program that was started, we certainly want to see continue to move. I do want to thank the board. I know the $15 million investment we made recently out of some of our CARES Act funding is providing a lot of help and support to be able to get going, along with the $25 million in the Behavioral Impact Fund that I think gives us a great opportunity to move forward. We certainly have work to do on our syringe service programs, which are an important part of harm reduction, and the behavioral health being obviously the combination of mental health and drug treatment. And along those same lines, I look forward to updates on the Accelerated Connections to Treatment program, so we can truly add those abuse treatment programs to our psych hospital to make sure that we are addressing both aspects and both sides of what we're doing, along with the continued work that we're doing around care coordination, which is a vital component of getting person-centered care, and in the joint agreement with UC San Diego Health and with the county around that, make sure that we're standing that up along with the Rady's Children's Hub focused on those issues. So we certainly have a lot of work, a lot of pieces, a lot of things moving. And I think now more than ever, we have to continue full speed ahead with our investment and our commitment to these issues. So pleased to support this and know that we have a lot more work to do.
Very good. Thank you, Supervisor. We do have a motion by Supervisor Jacob, seconded by myself, to go ahead and approve the staff recommendations on item number 5. Clerk, please call the roll.
Thank you, Chairman Cox.
Aye.
Supervisor Jacob.
Aye.
Supervisor Gaspar.
Aye.
Supervisor Fletcher.
Aye.
Vice Chairman Desmond.
Aye.
Chairman Cox, that motion passes unanimously with all board members being present and voting aye.
Okay, we're going to deal with item number 4 right now, which is to receive an update on the COVID-19 response, ratify actions, and authorize any other action necessary to address the COVID-19 pandemic. Before we get to that item, I want to take the prerogative of just making a couple of observations. Unfortunately, in our last meeting, there was a couple of speakers that I think unfortunately went over the top. They made negative comments about our public health director, which is certainly their prerogative, but they also identified her home address, which was totally inappropriate. Unfortunately, our system here with the delay we have precluded us from basically blanking out those comments over the live portion of this meeting, but they have been removed from the videotape of this meeting. I want to admonish or advise any of the speakers today that we have a tough job here at the county, and our public health director has the toughest job of any of us. As a part of the record, there are 17 letters of commendation, emails that have come in over the last 2 weeks in support of Dr. Wooten. And those will be made a part of this record, so that it'll be a part of the permanent record of these proceedings. but I want to speak on behalf of myself, and I think I can speak on behalf of my colleagues on the Board of Supervisors, that we have complete confidence in Dr. Wooten and her medical staff and the job that she's been doing over these last few months. It's been a very difficult time for everyone, and I can assure you she has the toughest job in the county right now, having to deal with these issues. I think she's done it in a very responsible manner, and I sincerely appreciate her efforts on behalf of all the citizens of San Diego County. I know we have some 56 speakers that wish to speak on this item. I'm going to ask the clerk, I'm going to ask the staff to go ahead and start with the presentation. And I believe Don Stoyer is going to go ahead and start with.
Thank you, Mr. Chairman. Before Mr. Story begins his presentation, I'd like to note that any members of the public that have requested to speak on this item, please dial into the conference line now using the instructions that were provided to you. And as stated, you will be muted until it is your turn to speak. Thank you.
Good morning, Chairman Cox and members of the board. As you know, several new developments have occurred with COVID-19 over the past few weeks. Across the state and here locally, we have seen big jumps in our case counts, and hospitalizations are up as well. We have hit a few of our local triggers for modifying the health order, including seeing a significant number of community outbreaks. And during the recent holiday weekend, we were added to the state's watch list for having an elevated case count for 3 days in a row. Later in this presentation, our public health officer will dive deeper into what that means for the San Diego region. As a county operation, we decided to pull back on the opening of the county facilities. We were planning to reopen library branches yesterday, but we put that on hold. And we closed offices here at the County Administration Center to most public services, including treasurer tax collector and the assessor, recorder, county clerk, for the remainder of the month. It's frustrating to take a step back, but the numbers show this virus remains a growing health threat, and protecting the public's health is of utmost importance. You've already heard from Dr. Luke Bergman, director of our county's behavioral health services, present the quarterly update on our behavioral health continuum of care. We thought this was a great opportunity to invite him to join us to highlight how behavioral health services have been impacted by the COVID-19 pandemic. In addition, our public health officer, Dr. Wilma Wooten, will provide a public health update and will discuss our local county triggers and our status on the state's monitoring metrics. We'll also be joined by Andy Pease, our Incident Command Finance Chief, to provide an update on the CARES Act framework. Without further ado, I'd like to welcome Dr. Luke Bergman.
Thanks, Don. The current COVID pandemic has been both a public health and a behavioral health crisis. Initially, we were primarily concerned about fear, anxiety, and depression associated with social isolation, disconnection from what had been normal sources of social support, and fear about the physical dangers of COVID-19. With the economy now in the midst of a generational downturn, concerns regarding the long-term behavioral health impacts of COVID-19 have been amplified and sometimes have reached a fever pitch. We've heard alarming references to the deadly behavioral health consequences of COVID, but without many references to actual data. So I want to begin with a level setting around what we actually know about the state of our community's behavioral health in the midst of the pandemic. What have the measurable impacts been thus far? I'll then transition to a brief discussion about how behavioral health care provision and utilization have changed, what's happened with the behavioral health care system, and are people with behavioral health conditions getting the care they need. The best population-level indications of the impacts of the pandemic are from survey data, capturing what we call psychological distress that has been collected over the last few months, and that are also collected biannually, giving us a basis for comparison. The headline is that it's been much worse during the pandemic than in previous periods. Across demographics, psychological distress is over 200% worse, and among some study cohorts, it's over 8 times worse now as compared with 2018. In findings published in the Journal of American Medical Association, we see that rates of psychological distress among people in lower income brackets are especially high, both during the pandemic and in previous years, with rates among households making under $35,000 around 75% higher than among those making $75,000 or more. And we see that rates among people identifying as Hispanic are 35% higher during the pandemic than rates among people identifying as white or black, where they were relatively comparable to previous years. This highlights a particular vulnerability that's been noted in this convening previously. The data that are most frequently invoked as an index of how we are doing are mortality data. With rates of distress so elevated, we might expect to see commensurate increases here. But the data rigorously collected and reviewed by our county medical examiner are clear. Suicide rates are static, and if anything, are trending downward. This doesn't mean that we won't see that trend line change. Suicide rates almost always increase with bad economic times. We will have to remain vigilant about suicide risk and continue investing in upstream protective measures. Drug use mortality has also been getting a lot of attention. What we see there is interesting and cautionary. Concurrent with the issuance of the shelter-in-place order, there was a substantial uptick in accidental deaths related to substance use. Though we haven't run analyses to confirm any particular cause, we would expect to see this kind of increase with any significant disruption in patterns of drug use, where people may be more likely to be using alone, where they may be using from a different supply, or they may be using after a period of sobriety supported by treatment, which might have been interrupted. Which gets us right at the heart of questions about continuity of behavioral health care utilization. There's been a lot of talk across the country about reductions in ED visits in the face of the pandemic, and we've seen that in San Diego County as well, as the graph on the left illustrates. While this has been true across populations and categories of medical presentation, relative rates of psychiatric and drug use-related visits among the overall number of folks showing up to the ED have increased somewhat. Still, reductions in ED visits are certainly part of a dynamic that resulted in a precipitous drop in inpatient psych hospitalizations for a period following the initial shelter-in-place order. At our San Diego County Psych Hospital, we saw the census drop from being consistently over 50 and often over 60 down to the 30s. Since the beginning of May, the numbers have returned to where they were, but the loss in care that this dip reflects, multiplied across other services, indicates a drop in access that likely will have consequences into the months ahead and will compound what we already anticipate being substantial increases in need for care in the future. We also have concerns about loss to care and its future consequences across the behavioral health specialty care system, which is community-based care that the county contracts with hundreds of local organizations to provide. There are two high-level points to make about these data. First, there's been a wholesale and frankly really impressive shift from face-to-face contact, represented in this graphic with the blue sections of the bar, to telehealth and telephonic care, represented with the orange and yellow sections respectively. I'd note that telehealth has been around for a long time, but its incorporation into daily practice has been challenging. So to see this kind of adoption virtually instantaneously is pretty incredible and a testament to the commitments of our community's treatment providers. Second, while the volume of care shows some dip and then gradual rise among both mental health and addiction services, the decrease that we see across the substance use disorder treatment system has been profound, close to a 40% reduction in the weeks just following the shelter-in-place order. And as with our inpatient setting, we will need to anticipate that these losses will compound increased needs for care that we'll see in San Diego County over the next months and years. We've looked closely at these data to discern among which populations there may have been the greatest losses to care so that we can be instrumental in re-engaging and mitigating risks. What we found is a little surprising. There's no significant difference among racial or ethnic groups or between genders. There are some differences by geography that are noteworthy, with those in the central region, inclusive of the city of San Diego, showing the greatest decreases in access to mental health care, and those in the north central region decreasing the most in access to substance use disorder care. But the most significant factor in estimating associations with loss to care is age. And counterintuitively, for those of us who envy our children's tech savvy, the biggest decrease has been among our youngest cohorts of clients, those under 18, among whom we've seen a 12% decrease in access to mental health care and a 29% decrease in access to substance use care. The Behavioral Health Services Department has developed a playbook to facilitate our work with contractors to improve care access in as timely a fashion as possible. We will need to continue watching all of these data closely. Now, I'd like to pass it over to our Public Health Officer, Dr. Wilma Wooten, to give an epidemiological update. Thank you.
Thank you, Dr. Bergman. Good morning, Chairman Cox and members of the board. The number of COVID-19 cases continues to increase significantly to the point that San Diego County is now on the state's watch list as of July 3rd. Since the last presentation to your board, an additional 5,904 cases have been reported for a total of 17,000 positive COVID-19 cases through July 6th. This table provides a summary of these cases with a breakdown by age, hospitalization, intensive care unit or ICU admissions, and death. 9,754 of the 17,000, or 57% of all cases, are between the ages of 20 to 49 years of age. 1,912, or 11%, have been hospitalized, which has decreased from 14.7%. But I'll talk in a few minutes about how that has changed over the past 2 weeks. Of the total, 516, or 3% of the total number of cases, are in the ICU, and unfortunately, 387, or 2.3% of the total number of cases have died. Taking a deeper look at the death demographics, the 368, or 95%, were all above the age of 50 years of age. 57% were male, 42.9% were female. With regards to race and ethnicity, approximately 44% were Hispanic or Latino, about 41% were white, 12% were Asian, 3.4% Black or African American, 0.3% were Pacific Islanders. And to date, there have not been any American Indian or individuals of multiple races identified in the group of those individuals who have died. We do, however, have 5 cases that had unknown race and ethnicity. And as a reminder, all of our statistics shown here today, as well as other information related to cases stratified by zip code, cities, and race and ethnicity, is found on our website. In this next slide, I wanted to show you what hospitalization has looked like over the entire course by week, and also during the last 2 weeks. So as you can see, since March, we had the second week of March, or the second week there identified. We saw a down slope in weekly hospitalizations. And then at the end of May, late May and early June, we started to see a slight uptick. And in the last 2 weeks, there have been 127 hospitalizations in that first week there, which is through June 28th. And then in the last week, we have had 158 hospitalizations. If we go to the next slide, this clarifies it even a bit more. Since June 21st, we have seen a dramatic increase in hospitalizations over the past almost 2 weeks. And going to the next slide, we will transition to ICU admissions, which are a subset of overall hospitalizations. And here we also see an increase in the last 2 weeks, going from 35 ICU admissions in the past week, and the week before that, there were 30 ICU admissions. So again, an upward trend. And then in this next slide, the same has occurred for deaths. If you look on the left side of the slide, in the latter part of May, first half of June, we were seeing actually a decline, but in the last 2 weeks, We have gone from 23 cases from June 22nd through the 28th, and then 26 deaths in this last week. So again, in that 2-week period, we're seeing also an uptick in deaths. In this next slide is a classic epi curve, which shows cases by onset of illness. And in recent weeks, starting in the middle of June, we have an obvious increase. And under the bar, which is the last 14 days, we know that we will expect to see increased cases, and these additional cases will take us even far beyond the highest peak, which is on June 21st. So again, we know that COVID-19 is pervasive in our community, so the actions we'll talk about in a few minutes hopefully will help to mitigate and turn this around. In the next slide, this is our triggers. As you know, the county has identified and continues to assess 13 triggers for modifying the health officer's order across 3 categories: epidemiology or surveillance, healthcare or hospital capacity, and public health or our response. This slide shows a snapshot of the county's performance pertaining to the 13 criteria and triggers. A green check means that we have not reached the trigger measurement and remain in good standing, and you can see that 10 of the 13 triggers fall into that category. A red mark means that the trigger has been met and actions need to be taken, and we have 3 triggers that fall into that category. To align our measures more closely with the state, we have revised 2 of our triggers, trigger number 1 and trigger number 10. Number 1 is related to case rate, and trigger number 10 is regarding testing positivity. In the following slides, I will talk about each of these triggers, and we will focus on the metric that has landed us on the state's watch list, as well as the triggers related to community outbreaks and case investigations. So if we go to the next slide. The first criterion here is case rate, and this is related to our first trigger. Trigger number 1 is met when the rate is greater than 100 per 100,000 population for a 14-day period with a 3-day lag. This is also the state metric, as stated before, that has placed San Diego on the state's watch list as of June 3rd. The case rate metric is used to assess the level of COVID-19 burden in a county. This metric is calculated by the total number of cases diagnosed and reported over a 14-day period divided by the number of the people living in the county or the population, and this number is then multiplied by 100,000. As of July 6th, the case rate is 136.1 per 100,000, and this metric has been elevated since June 30th. Hence, San Diego County was placed on the state's county monitoring watch list for the next 3 weeks, requiring closure by the state of all indoor operations for restaurants, bars, wineries and tasting rooms, movie theaters, family entertainment centers, zoos and museums, and card rooms for the next 3 weeks. And the health office's order was revised yesterday and posted effective for midnight this morning. Going to the second criterion in the epidemiology category, this is related to community outbreaks. We've been talking a lot about these community outbreaks over the past several weeks. Trigger number 2 is met when there are 7 or more new outbreaks in community settings in a 7-day period. For the 7-day period from June 29th through July 5th, there have been 21 new outbreaks in community settings, with 14 of the 21, or 67%, in restaurants and bars. And in the next slide, You will see the list of these 21 outbreaks in the various settings. Again, the majority are in restaurant and bars. There are 2 grocers, a private residence, and a food manufacturer, as well as a business. But again, most are in restaurants and bars. So in the next slide, the next criterion is testing positivity. This is also a state metric related to the state's watch list. San Diego continues to perform well in this metric. However, a slight increase has occurred over the past week. Trigger number 10 is met if there is greater than 8% of positive tests as a percent of total tests measured using specimen collection date in a 7-day period with a 7-day lag. The previous metric was very similar, but used a reporting date. So we have changed this again to align with the state's metric. As of July 6th, there is an average of 6.3% of positive tests as a percent of total tests in the 7-day period before the most recent 7 days. And this trigger is also related to and aligns with the gating criteria, which is a federal metric, number 3. In the next slide, the criterion is related to case investigations and is associated with trigger number 11. This trigger is met when 70% or less of case investigations are initiated within 24 hours of notification over a 7-day period. For the 7-day period from June 28th to July 4th, 57% of new positive investigations were initiated within 24 hours. Many of the investigations are now initiated within 48 to 72 hours, and we look forward to returning to the original time frame of 24 hours through the following mitigations on the next slide. Oh, if you could go back to the last slide. This is showing that as case investigations go down, it is due to the increase in the number of daily cases reported. And on July 1st, we had our highest single-day number of cases at 584. And this trend, again, continues. In the next slide, staff is implementing key mitigation efforts to maximize staffing for case investigations. These include onboarding the investigators already in pipeline, onboarding new investigators through weekly trainings for nurses and epidemiologists who primarily comprise the positions for case investigations. Also redeploying a dozen or more previous investigators from county surge staff to assist, and requesting existing investigators and temporary nurses to do overtime, as well as shifting county staff tracers and team leads to help with the case investigations. On this slide, we are showing the state monitoring metrics, the 6 metrics that are used to determine if a county goes on the state monitoring or watch list. On June 30th, the state flagged San Diego County for its elevated number in the metric case rate per 100,000. The state's process is if any of the state's metrics are elevated for 3 days, then the county would be placed on the state's watch list. In San Diego's case, the case rate metric was elevated for 3 days, June 30th through July 2nd. And the county was placed on the state's watch list on Friday, July 3rd. And since the 30th, every day, San Diego County has exceeded this metric related to case rate per 100,000 population. And I will discuss the implications of this in a minute. This slide illustrates a snapshot in time where we analyze the drivers of the increased COVID-19 cases. Over a 14-day period from June 17th through June 30th, there were 4,745 positive COVID-19 cases reported for San Diego County residents. Of these cases, 2,278 or 48% were in the 20 to 39 years of age group. This younger population tends to gather in public without facial coverings, and practicing social distancing. Other demographics were reported and include healthcare workers represented by 263 cases, or 5.5% of the total number of cases. Congregate facility outbreaks represented by 248 cases, or 5.2%. And food service employees, we had 210 cases, or 4.4% of the number of cases in that 2-week period. Also, for the same 14-day period, 25% of cases reported to reside in the South region, and 24% reported living in the Central region of the county. As shared previously, based on the governor's directive, and any county that is on the state's watch list for 3 days is required to implement restrictions that will be coming up in this last slide. And as already stated before, as of yesterday, July 6th, the county has been placed on the state's watch list for at least the next 3 weeks. Based on the governor's directive, San Diego County is required to implement the following: indoor restrictions related to indoor dining in restaurants and bars, wineries and tasting rooms, zoos and museums, movie theaters, family entertainment centers, and card rooms. In San Diego County, we are following guidance from the governor's office and the California Department of Public Health based on the data. Since the beginning of the pandemic, San Diego County has strived to align with federal and state metrics and use data and science to drive our response to COVID-19. It is important that we continue to work together and take actions that limit the transmission of COVID-19. Only together can we make a difference to stop the spread of this disease. Now please welcome Andy Pease, Acting Chief Operating Officer.
Good morning. On May 19th, this board approved the CARES Act allocation and reporting framework, which this slide reflects, totaling $339 million for these various components. At the last board hearing on June 23rd, I provided an update on spending for each component with an estimate that our fiscal year 1920 overall cost will be approximately $130 million, and nothing has changed regarding those estimates. We'll have final costs for 1920 once we finish with the closeout process later this month. I am here today for an update to our CARES CRF funding tied to the recently enacted state budget. There are two noteworthy budget items in the fiscal year 2021 state budget for your consideration. The first has to do with the 17 small cities within the County of San Diego. As a reminder, these 17 cities were ineligible for a direct CARES Act allocation. Only the city of San Diego was large enough to receive a direct allocation. Your board took action and allocated $25 million of our CARES Act to these 17 cities to assist in their COVID-19 response efforts. Since we last met, the state has now made available $500 million of its CARES Act funding for the smaller cities, of which our 17 cities are eligible for $17.4 million in total. Combined with the $25 million, that totals $42.4 million available to these cities for use. Now, what's important is to access these dollars, the cities must send a signed certification form to the state by July 10th, indicating that they'll use the funds in accordance with federal guidelines, that they'll adhere to the state's stay-at-home orders, the gubernatorial executive orders, and all California Department of Public Health orders, directives, and guidance in response to the COVID-19 emergency, and that they'll return any unspent funds by October 30th unless extended by the Department of Finance. Now, likewise, with the same requirements to adhere to the stay-at-home orders and the gubernatorial executive orders and the same parameters and the same timelines, the County of San Diego is also eligible for an additional $53.7 million of federal CARES Act through the state. Now, the County of San Diego's initial CARES Act allocation was $334 million, and when you add the $53.7, it totals $387.8 million in funding available. With the $339 million that your board already approved for use, this leaves $48.8 million of unallocated available CARES Act funding for your consideration. In closing, as you consider how these dollars could be utilized, as a reminder, these funds must be for necessary expenditures tied to the public health emergency. This could include things such as public health costs, medical costs, testing, investigation costs, public health measures such as sanitation, childcare, food delivery, improving telework capacity, care for homeless population, as well as costs for the provision of economic support efforts such as small business grants, rent relief, as well as any other COVID-19 related expense reasonably necessary to respond to the COVID-19 emergency. I'll now turn it back over to Don Stoyer for closing comments.
Thank you, Andy. In addition to receiving this update, we recommend your board take the following actions with respect to this item. Ratify all actions previously taken in response to this local health emergency and local emergency. And finally, take any other actions necessary to address COVID-19 pandemic emergency response. Subject to your questions, this concludes our presentation.
Okay, let me ask if there are any questions of staff by board members before we get into the public testimony. Yes, Supervisor Desmond.
Thank you, Mr. Chair. I got a couple questions for Dr. Wooten. First of all, on the, I guess it was slide 11, which was the deaths reported via the over the last few weeks. And in that, you stated there was a slight uptick in the number of deaths. And I guess when you, I don't know if we can pull that slide up, if that's possible, slide 11 as part of the presentation. Thank you. And I think you said for the 2 weeks in June that it came to 23, or I guess 26 and 23. So I guess you could compare those to the bar charts on the left. So, you know, to me, I guess from my perspective, looking at from like mid-April to mid-May, we're trending down in the number of deaths, just strictly the number of deaths, even though we had 23 and 26 and 23 for the 2 weeks on the right. And because I guess what I'm concerned with, I guess, is the rate of deaths. We know that now we're getting about twice as many positive tests, twice as many people are testing positive because we're doing more testing. But the rate of deaths seems to be much lower, because even during that April and May timeframe, we only had about half as many people testing positive. Now we have double the number of people testing positive, and still the lower end of the death rate. So, you know, I know any death is tragic. I'm not trying to belittle it, but it seems to me like we're actually decreasing, particularly in the rate, based on how many people are testing positive of deaths in San Diego County. Am I way off base? Is that a true assessment? I'm just kind of curious what your thoughts were on that.
Supervisor, overall deaths, hospitalizations and deaths are decreasing, but we have to look at the part of the pandemic where we are seeing the increased numbers of cases that are being reported. And that has been occurring over the past 2 weeks. So what the intent of this slide was to show that in the past 2 weeks, the most previous week's 26 deaths, and the week before that, 23 deaths. If you compare that with the weeks before, or actually the most immediate week, which is June 13th to June 19th, these numbers are above that. So just trying to show that in the past 2 weeks, we are trending upward. But we would have to continue to monitor that if that trend continues. And with the actions and restrictions that have been placed by the state, we hope that those numbers begin to trend downward again.
Okay, well, I guess I'm looking further back at the larger picture instead of just the last week that appears to be overall. But I appreciate it. And then I have another question is, why the 3 weeks? And I know this is the state came up with the 3 weeks, but you know, our incubation or isolation periods have been 14 days. And now for this new set of closures, it's 3 weeks. And I didn't hear any justification from the state as to why 3 weeks was picked. Do you have any idea, or this is just from the governor's office?
Well, it's from the governor's office, but the rationale is that while the incubation period is 14 days, sometimes people might be in different stages of their incubation period, and from the time that they develop symptoms, you add on that additional 14 days. So the 3 weeks just helps to capture anybody that may have been exposed, but 14 days is the incubation period. So that additional week was added to try to capture all individuals that may have been exposed, and so that people could recover. Because some people that do become ill, while if they are tested, they should be released from home isolation after 10 days, but some people, their symptoms last longer. So it was an additional week of good measure.
All right, thank you.
All right. No,
Mr. Chairman?
I wanted to speak, and then Supervisor Fletcher, and then Supervisor Jacob. Supervisor Gaspar, go ahead.
Thank you, Chairman. Thank you, Dr. Wooten, for your report. I want to take a little bit of a deeper dive into the community outbreaks. Specifically, I was looking for a cumulative number of people impacted by the community outbreaks. Can you provide some information as to how many individuals are involved with our total community outbreaks at this time?
I will provide that information tomorrow for you, or later this afternoon, Supervisor Gaspar. We didn't break it down for this group, for the entire group. We have it broken down by skilled nursing facilities, long-term care, and all community outbreaks, but not for the 21 community outbreaks that are related to the metric. But I can get that for you this afternoon,
you.
Not a problem.
Okay, thank you. So let's then take a look at, you have total community outbreak numbers for the pandemic period?
Yes, there are, some are inactive, but there have been a total of, I believe, 68 community outbreaks since the pandemic has occurred.
Oh, actually, I'm interested in how many individuals were involved in those total community outbreaks. Do we have that?
Yes, I do.
Thank you.
Give me a moment, I can bring it up here. So for the period, and I have it for the ending on through 11:59 on July 5th, which was Sunday. And we have, again, a total of actually 74 community outbreaks, and the total number of cases associated with those outbreaks is 660 cases and 6 deaths.
Okay, and then how about for skilled nursing?
For skilled nursing facilities?
All right, do you have it just listed as congregate care facilities, or how is it broken down?
Well, it's initially talked about in regards to congregate care facilities, and those are broken down into 2 groups, which includes skilled nursing facilities. We've had a total of 1,053 cases related to 39 outbreaks and 98 deaths. And then for non-skilled nursing facilities or long-term care facilities, we have had a total of 1,172 cases associated with 81 deaths.
Thank you. I appreciate that. And next, I want you to walk me through a little bit our case investigations process. I wanted to learn more myself, so I went on to Johns Hopkins certification course and became a certified contact tracer so I could better understand how those case investigations are conducted. And I think it's important for our community to understand how we're conducting those here. In my training, we were taught that any individual within 6 feet of an infected person for at least 15 minutes of a lab confirmed or probable COVID patient were the ones that we were focusing in on and doing that additional research. Is that consistent with what we're doing in our investigations?
Yes, Supervisor, that is exactly consistent with what we are doing. And when we interview cases of who their close contacts were, yes. That is the definition, that's the CDC definition that is used by all jurisdictions across the U.S.
Perfect. And I see that we have a number of community outbreak cases related back to restaurants, but it seems as though that would be a place where you sit with another person who may be from outside of your household, and you're definitely in their presence for 15 minutes. In the event that you sat with someone at a restaurant, that would be an identified close contact, correct? And someone that would be looked into if there was a confirmed case. And at the end of the day, those two people, and possibly a third at that same table, were found to be positive cases, then that would be an outbreak attributed back to the restaurant, correct?
There are several categories of how an outbreak is defined. It could be with the staff, it could be staff and patrons, or it could be patrons. So those are the three categories.
Sure, but if three people, let's say, ate at a restaurant together, they all came down with this, they were exposed to one another for a period of at least 15 minutes throughout that dinner, then that restaurant is now credited for that outbreak, correct?
Well, we interview the staff as well. The staff may become infected. But again, if you're asking if we only have patrons that are associated.
No. I'm just trying to, I guess the point that I'm getting at is a restaurant seems like a likely place where you're meeting with someone for 15 minutes. Therefore, we should see a increased risk associated with any activity where you're sitting with someone for extended periods of time. So it's not unusual, in other words, that we might see that there. You might see that in a church, for example. A grocery store is a little more interesting. I think what tends to happen, and I think what our data has seen, is that some of these outbreaks may be attributed back to the business, but it's actually employees or workforce that are social. And what's happening is they, interact at work and they're under a lot of guidelines, but after work, that might be a different situation. I think that we've seen correct in our information that there are situations where it's because people form bonds with one another in the workplace that actually the behavior may have been caused outside of the workplace. So what do you do in situations where you have employees that may have been social outside of the workplace? If you see 3 employees, for example, that were social outside of the workplace, does that get pinned back to their place of work, or does it go into the community outbreak category?
Supervisor, sometimes it's very difficult to identify where exactly an individual contracted the virus. But again, and we're talking about restaurants, there could be 3 scenarios. It could be only staff, it could be staff and patrons, or it could be patrons only. And in those 3 categories, if it is tied to the restaurant, then that restaurant is tagged and it's given to our outbreak investigators, and they conduct an investigation to determine if a bona fide outbreak can be defined. So that is our process in identifying outbreaks at restaurants.
Okay, thank you. I appreciate that. Tell me about our tracers. Are they asking about people's mask habits?
Yes, actually, the tracers, to my understanding, are asking a myriad of questions. We actually ask staff to ask additional questions as we open up various venues, as the marches, civil unrest protests occurred. We started asking about that. So those questions are being asked of the contacts. We've tried to adjust our questions to reflect what's currently going on with our opening up and other events such as the protests.
Thank you. I appreciate you doing so. So is that where we got the information you presented today? You presented a metric where 48% of the cases, or 2,278 individuals, fell into that 20 to 39-year-old age category. Is this where we've made the determination that these cases are linked to backyard barbecues, bars, and non-mask wearing? Is it rooted in the data that we have?
Yes, Supervisor Gaspar, we do try to solicit that type of information as much as possible.
Okay, but we have somewhere all of this information coming from our investigations that's contributing to the generalizations about these populations. It's not just our thought, it's like actual data that we have from the investigations.
Epidemiology is never about our thought. It is about the data that we gather from the cases as well as the contacts associated with those cases. So this information is data that has been gathered from our staff as they interview cases and find out information about the contacts that they've been associated with.
And then in that age group, maybe you presented this data, that 20 to 39-year-old age group, what % is translating into a hospitalization or ICU visit?
I would have to go back and have staff analyze that. Actually, I've asked them to look at that same group and actually to even update it up through July 6th and to include hospitalization. So our staff is working on that.
Thank you, I appreciate it.
Okay, we'll proceed now to Supervisor Fletcher, had some comments, and then to Supervisor Jacob.
Yeah, thank you, Chairman Cox, and I appreciate the update from Dr. Wooten and everyone's efforts to help us try and slow the spread. We slow the spread of coronavirus in order to protect our economy, keep our jobs open, protect life, protect the integrity of our healthcare system, and we know that we have a ways to go. But we certainly have to continue being very mindful of the metrics we've outlined, and really understanding the significant lag that you often see in terms of ICU utilization, hospital utilization, and death, coming significant increases in those categories sometime after you see a rise in cases. We're seeing a number of places. I think Florida is a good example where a shockingly large number of their counties now have essentially zero ICU capacity in their healthcare system because they had a preceding few weeks ago spike in their cases. And so we're mindful that it is important that we take action before we see the hospital system overwhelmed in an effort to try and avoid that. So I support the efforts of Dr. Wooten and our public health department as we continue to do the best we can to manage through a very difficult situation. I do want to make a couple comments initially, and then I suspect we'll have greater deliberation on this either now or after public comment. Around the CARES Act funding, and in particular, the additional $53 million that is coming into San Diego County for us to consider where we would go and what we would do with that. And I want to highlight two things that I think are vitally important to our economic recovery. And that is first, the childcare industry in terms of a significant investment that I believe that we need to make in the childcare industry as a component or foundation of our ability to move forward and to get our economy back up and running as we get to slow the spread here hopefully over the next 3 to 4 weeks. And then the second thing that I think we need to focus on is a dedicated and robust effort around testing for our K through 12 public schools. We know simultaneously to childcare that public schools are a vital component of our ability to move forward. And we've been working, my office has been working very hard with a group of scientists, with some of the leading minds in testing from UCSD and Scripps Institute and other places to come up with some foundational ideas for how we might monitor the situation in schools. I think there is some new science around wastewater treatment, around the bundling or batching of tests, along with diagnostic tests. And I know our schools are dependent upon us as a public health agency to be able to come up with a system and a plan and a program that gives us the best shot of monitoring the situation in our schools to protect our children and their parents and their families, along with the teachers and staff who are there. And so what I would do is just for discussion purposes, put a motion on the table to direct the CAO to establish a fund totaling $25 million in new CARES Act funding for child care providers struggling to remain open or reopen due to COVID-19 pandemic. This would be available to cover costs, including but not limited to staffing, supplies, business resilience, mortgage and rental assistance, or capital improvements related to outdoor areas. And second, direct the CAO to establish a fund totaling $10 million in new CARES Act funding to support the county's Department of Public Health testing, tracing, and treatment strategy specifically dedicated to San Diego County K through 12 public schools. And just to add on to what we're talking about around childcare is we know that there have been some efforts. We certainly led in an effort to provide vouchers for this childcare industries, but we have more than 600 childcare providers have completely closed their businesses. And many of them are going to need significant help in terms of accommodating the changes in the number of kids, in terms of accommodating the changes in the safety protocols and procedures. And so I think if our staff could come up with a holistic plan, a regional plan for how we can most strategically invest in helping this industry get up and running and stay up and running in a safe and responsible way, I think that would be appropriate. And then on the school testing, again, we've got over 500,000 school-age children that it is uncertain when or how they will return to school, but we know at some point schools will return. And so it is, I think, vitally important that we get ahead of the curve here on really making an investment to assist our schools and our child care providers. And so I think this wouldn't encapsulate the entire $53 million that we have to decide on, but I think it would be appropriate to invest $35 million of that 53 in child care provider strategy and in testing for our public schools. Thank you.
Supervisor, I'm going to ask you to hold that motion until after we have the public testimony. I will call on you first.
Okay, fair enough.
Supervisor Jacob?
Yes, Mr. Chairman, thank you. A couple of comments, and then I'll get my oar in the water. I'm sure others would like to do that too. I appreciate you holding on that motion. While I don't disagree with the child care and the testing issues, we may want to discuss more of the amounts we want to allocate to each one of those. I've become familiar recently with the Great Plates program in talking to a couple of seniors that are actually using the program. And I'm pretty excited about it, and I believe it needs to be expanded. Either we can build on the program through FEMA and the state that we're currently engaged in, which is about a 3.5 million monthly program, or we could establish our own program. What this does is this: we know that our restaurants are in dire straits right now, particularly with the in dining option they no longer can do. So what the Great Plates program does, it not only provides really good quality food for the seniors who are in need, but it also gives business to the restaurants. So we're doing economic stimulus, we're helping restaurants, at the same time we're feeding seniors, and then there's a triple win on this because the meals that are delivered cannot be left on the porch. They're delivered by the restaurant. They actually need to be delivered to the person that has ordered the meals. So I think this is like a triple win. And I would like consideration at the time that we do a motion to consider either our own Greater Plates program or expanding the Great Plates program that we're already implementing. And I would like to boost that up to another 7 million a month so that it's a 10 million monthly program ultimately. The problem with the program we have now, our staff is not going to know until July 10th whether that program is going to be extended for another month. I think we need to involve more restaurants. As I understand, there's only 31 restaurants involved right now. We need to expand that and make sure that that's distribution is throughout the county, and that gives businesses and helps businesses. And later, I'd like to read a letter or an email that I just received recently. In fact, I'm going to do, well, I'll do it later when we get into more discussion on this, but I think it really points out exactly what I said about this program. It's a triple win. It helps the restaurants, it's economic stimulus, it helps feed seniors that are needy, and it helps to check on seniors that may have other needs. And there's examples of that. The other thing I want to say, and this is to Dr. Wooten. Dr. Wooten, for better or for worse, you have, as the chairman said, the toughest job in the county today. And I applaud you for the job that you're doing. And I know you're taking heat for it, more heat than probably any of us in elected positions have ever taken. Well, I don't know about that, but anyway, it's a very, very tough position. I never realized myself until we got involved in this that the public health officer has so much power. But the fact that you base your decisions on science and evidence, it's not arbitrary, it's not your own judgment, they are decisions that are based on evidence and science. And I applaud you for that. And I would hope, Mr. Chairman, if anyone comes up to the podium today and does what happened before, that you shut them down or they're immediately removed from their ability to speak. Yes, people do have the right to speak and voice their opinion, even though it may be different than any of us and Dr. Wooten. And they have a right to a different opinion, but they don't have to be disagreeable with that opinion, and they don't have to be disrespectful. So I appreciate, Mr. Chairman, what you started off with and sending the message to the people who are going to be speaking today, and to not allow that kind of comment. I think it's totally out of line. So thank you, Wilma. I know it's a tough job, but hang in there, and just know that I, for one, support the work that you're doing.
Thanks, Supervisor. We did have a request from 56 people to speak. It's my understanding that we have 38 that are available right now. And so what I'm going to ask the clerk to do is to go ahead and start calling up those speakers. I'm going to ask each speaker to be limited to no more than 2 minutes and try not to be repetitive. We certainly want to hear your comments, but we would appreciate to the extent you can be brief in your comments and to the point, it would be very much appreciated. So Andrew, would you go ahead and start calling up the first speakers?
Thank you, Mr. Chairman. I'll note that we have received 129 e-comments on this item. And as you noted, we have now 36 individual callers on the line to address the board. As a reminder for the callers, if you do not wish to speak on this item, please hang up and call back when the board begins discussion of the next item. We'll be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted, and each caller will be asked to state their name for the record. You will have 2 minutes to address the board, as the chairman noted. You will hear this sound when your time is up, so please conclude your comments at that time. I'll remind the public speakers that they should mute their TV or live video stream before they begin speaking. Erin, please identify the first caller.
Thank you. Our first caller is 0084.
Hello, this is Ashton Forbes. I appreciate the questions today by Supervisors Desmond and Gaspar. The reason psychological distress is up is because of our actions. These aren't impacts of the virus. They're second-order effects of our reaction to the virus and ending our way of life. Crucial life-extending care was delayed. Children are going to bed hungry. Parents are wondering how they'll pay their bills. Families are becoming homeless. Now you've told them they may not see a paycheck for another 3 weeks. Why is it that more cases but flat hospitalizations and a declining deaths is a bad thing? I assume that the additional cases are directly linked to our own state-funded tracking and tracing program. I bet that many of the 2,000 plus cases aged 20 to 39 aren't even seeking medical attention. How many have mild to no noticeable symptoms? Doesn't that mean the virus is even less deadly than we currently believe? Is the rise in cases now because we're testing everybody exposed to a single individual? Under the tracking and tracing program, do cases even require a positive test? The CDC definition makes it seem like they're not required. Are antibody tests being counted as cases? I hope not. Otherwise, it seems like you're manufacturing metrics to fail your own triggers. The funds for these programs revert if they're not used, creating an incentive to promote them dishonestly. To summarize, we set our own triggers, we expanded testing with government funds, then we failed our own triggers because of our own increase in testing, all despite less people dying. The deaths related to COVID-19 nationwide are now so low that it's soon to lose epidemic status. How will you justify government overreach then? Will you apologize for your unscientific cherry picking and fear mongering? I doubt it. Please stop the security theater and look at the data honestly. We can't move forward until the people responsible for the lockdowns stop doubling down on being wrong. Thank you.
Thank you. Our next speaker is 0116.
Good morning, Chair Cox and board members. My name is Peter Comiskey, representing both the Balboa Park Cultural Partnership, a collaboration of 26 arts and culture organisations in Balboa Park, and Arts and Culture San Diego, a coalition of over 100 arts and culture orgs throughout the county. First, my congratulations to you for the efforts to be data-driven in managing COVID-19. I watch the county's dashboard daily and find the metrics compelling. While I fully understand the issue of indoor exposure and the risks that it carries, I want to express my concern for the impact of the most recent state-mandated closure to indoor museums as a result of the county being placed on the watch list. I'm not aware of any community outbreaks that have been caused by visits to museums. I believe there are good reasons for this. In addition to exceptional adherence to the guidelines for sanitation and behaviour, museums are visited by family groups who, in and of themselves, are apt to be responsive to physical distancing. In addition, you may not be aware that venues like Balboa Park have put in place park-wide conditions that mirror the expectations of the guidelines and communicate this to guests with over 50 prominent signs in both English and Spanish, as well as provide before your visit video and guidelines on balboapark.org. The results of the first few weekends of museums that have opened were positive and should serve as an example of a well-executed social distance, reduced capacity, and mask wearing. I understand the county is implementing the state's mandates. Moving forward, the Cultural Partnership would like to work with the county to advocate at a state level and provide data, metrics, and any additional information to assist you and the public health officials as they determine which sectors can remain open in a safe way while providing county residents the opportunity to enjoy our most cherished arts and culture experiences. Finally, please ensure that for any small business recovery funding, you also ensure that non-profit small businesses are also eligible. Thank you.
Thank you. Our next caller is 0193.
Hi, my name is Greg Malkin. I'm with Little Miss Brewing. I'm the operations manager. 4 of our 5 tasting rooms are currently closed, primarily because of 14C in the health order, which states that we're not allowed to sell beer outside unless it's also in conjunction with a meal. I note that in that section, it allows breweries and distilleries to sell alcohol without serving a meal. And San Diego is the capital of craft beer. I'd like to see that same section apply to breweries. And that's the only reason I called in. I thank you for your time.
Thank you. Our next caller is 0542.
Good morning. My name is Jessica Paskovich. I'm going to read from the Health Officer Practice Guide for Communicable Disease Control in California, issued by the CDPH, because apparently you guys haven't read it. Section 3, Constitutional Limitations. The Health and Safety Code grants broad powers to health officers to promote public health or safety. Actions taken under this statutory authority are an exercise of police power. This police power is limited by the protections contained in the United States and California constitutions as interpreted by the courts. Both the U.S. and California constitutions provide that life, liberty, or property shall not be deprived without due process of law. Due process requires fundamental fairness in governmental action. There are 2 major components to fundamental fairness. One addresses the adequate justification for the anticipated action. Health officer orders should not be arbitrary, oppressive, or unreasonable. Any health officer order must have an adequate justification if it impacts or limits liberty, freedom of movement, bodily integrity, privacy, or property. The necessity of the order is balanced against the extent of the infringement on the individual's rights. The justification for the order becomes more demanding as the individual interests at stake become more significant. Section 8B, closures of public gatherings raise issues regarding freedom of assembly, freedom of speech, due process, and equal protection rights. Closure orders cannot be arbitrary, oppressive, or unreasonable and must be narrowly drawn to be free from vagueness. These orders must have documentation that factually supports the justification for the proposed closure. Now, Board of Supervisors, do you really think Dr. Wooten's orders follow any of this? What's really happening here is that the general population finally realized their mortality, and now they are forcing the rest of us to ruin our lives so they can deceive themselves into thinking they are safe. But we are not saving lives with these closures and restrictions. We are only postponing death and causing deaths of despair. It's time to learn to live with the virus instead of trying to hide from it. Thank you.
Thank you. Our next caller is 0582.
Good morning, Board of Supervisors. This is Melanie Burkholder, candidate for the California State Assembly in the 76th District. This decision to start closing and restricting businesses is misguided and short-sighted. Establishments just now reopening, including some museums that have only just opened their doors, cannot be held responsible for outbreaks or rises in the cases of COVID-19 due to other factors. The real impact will be on the long-term health, including the mental health of the unemployed. From an Associated Press article published in late 2018, the AP analyzed life expectancy and demographic data for 65,662 census tracts, which are geographic areas that encompass roughly 4,000 residents. The AP found that certain demographic qualities, namely high rates of unemployment, low household income, a concentration of Black or Native American residents, and low rates of high school education negatively affected life expectancy in neighborhoods. Every week, we see more businesses like retail stores and restaurants shut their doors permanently because they are unable to fulfill their obligations. We can all agree that closing the doors of small businesses destroys jobs and livelihoods. By even the most optimistic estimates, we do not see a return to the low unemployment levels we reached just before the pandemic hit. Low income and minority communities are already suffering more, in large part due to COVID-19, will now have to weather more chronic unemployment that will continue to chip away at their quality and length of life unless we stop this back and forth with our economy. All of life accepts some level of risk, and we need to allow for freedom to experience that risk and make informed decisions based on science, data, and the totality of the circumstances. To take away our freedom and liberties is to take away what this great country was founded upon. Please allow for the full reopening of businesses. Thank you for your time.
Thank you. Our next caller is 0738.
Hello, my name is Emerald Lowe, and I'm calling on behalf of the Oceanside Chamber of Commerce. We've spoken to hundreds of businesses throughout this challenging time, and many of them have expressed deep frustration and devastation in regard to the recent reversal of openings and added restrictions. The businesses in our community that were initially forced to close have invested heavily into sanitation, signage, marketing, and other preparations required to reopen. They're taking your direction on this very seriously, but many aren't sure if they can even afford to reopen a second time if this continues over the next 3 weeks or indefinitely. As more individuals continue to rely on unemployment benefits, the chokehold to our small businesses will only continue to tighten while our workforce is quickly diminished. July should be a busy time for our restaurants, bars, and museums to recover some of that revenue they've lost unexpectedly over the past few months. It should be an opportunity for them to pay bills and take care of their employees. They need our help as local leaders to survive, not added limitations and unrealistic benchmarks to meet. Running a small business is no easy feat in any climate, so let's work together to do what we can, not to add more obstacles for them to overcome. We ask that county officials consider every possible avenue to help save our small businesses before it's too late. We ask that these businesses with these recent closures and added restrictions simply be allowed the same opportunity to continue to operate under the existing health guidelines like many other industries continue to do. And as far as I'm concerned, all businesses are essential and they play an important role in our communities. Thank you all for your leadership and dedication to serving our communities and allowing me time to speak on behalf of local businesses from our region today.
Thank you. Our next caller is 0953.
Hello, my name is Brian Dahl. I'd like to start by thanking Supervisor Desmond for his efforts to keep the county both optimistic and notified of new data coming out concerning the virus's nature and spread. Rising cases along with ramped up testing should be seen as a sign of progress in light of the number of deaths being down from April. You don't have to be a statistician to see this correlation is a sign of progress. Furthermore, neither the governors nor the national or local news coverage seem willing to recognize the new data, which suggests that the virus is less dangerous than previously believed. The World Health Organization stated back on June 8th that numerous countries' contact tracing showed asymptomatic cases were very unlikely to further transmit the virus. Yet, the governors and media continue disregarding new data in favor of parroting the same hysterical emergency measures from March and April. What are the implications of this? The more the governors enforce these emergency policies month after month, completely disregarding new data coming out, the more they put themselves in the position of parents who have become negligent to the point of forcing their children to have to parent themselves. This continued resistance to acknowledge new data has become a destructive and now predictable pattern of behavior. So what can we expect moving forward? If the proposed vaccines, which are already being rushed through their testing phases, should cause serious injuries and deaths to San Diego residents, how many months will have to go by before the governor will consider an alternative policy? The prospect of elected officials refusing to consider new data seems much more dangerous and terrifying than a virus with a 99% survival rate. So with that in mind, I'd just like to repeat my thanks for Supervisor Desmond's efforts to keep us up to date and optimistic that we are making progress in spite of the governor's and media's consistent fear-mongering. Thank you.
Thank you. Our next caller is 1107.
Good morning, counselors. $8 million. That's how much this county has made in payouts in the last 5 years to families whose constitutional rights have been undermined and are fighting against false allegations from CPS. Parents like Mark and Melissa Manns would like to see the reform of the system that they were promised. The same problems that the San Diego Union Tribune published in January of this year, exposing the growing number of payouts this county has made on the same issues over and over again, is not only ongoing, but it's been amplified by the effects of the pandemic. My name is Dominique Muskis from Chula Vista, and while confidentiality stops me from discussing in detail my family's case with CPS, I can tell you that it takes over 30 days right now for families to receive any services to alleviate concerns of the agency, and up to at least a week to receive any update from social workers regarding concerns of our children's care. Police need their funding to address the concerns of our community because most state employees right now with our agency simply is not equipped with the right training to handle the culture of fear that surrounds the calls to their hotline. The unnecessary trauma that our county face and the families in it must be stopped by giving the authority back to those who are trained to protect us. Within CPS, there's some great social workers. I'm not here to point out that the system of a whole as being faulty, but it's faulty enough that there's desperate need for it to be reformed. There's no accountability for social workers in our community who are altering petitions presented to the court. This group has been given so much power that even judges are not able to encroach on medical kidnapping cases because it's become so rampant in our community. The judges reviewing these petitions have about 5 to 7 minutes to look at a case in its entirety and make a decision that determines the outcome of that child's life. If a social worker is swayed by the heightened sensitivity and hysteria that's so prevalent today, and there's no legal ramifications, what is stopping them? There's no oversight. These cases are sealed, and that's the problem. That's what's costing our county millions of dollars in reparations to families who are unjustly split apart. It's time to take back the federal funding that is supplying these people and put a stop to this. It's our money that we need to take back.
So that's. You to please summarize your comments. Your time is up.
In summary, please give back funding to the San Diego Police Department so that we can handle these allegations because CPS is not protecting the children that are called to be served by them. Thank you so much.
Thank you. Our next caller is 1190.
Thank you. My name is Josh Rathwig. I'm a small business owner here in San Diego, a father and a husband. I just want to thank you and the supervisory team in advance. I know you have a lot of responsibility on your shoulders right now. So for my comments, I've never commented previously. I do so just with the intent of just maybe giving a perspective that I believe is at risk of being lost. And I hope maybe I can give a voice to some other business owners and families just like mine here in San Marcos. So we own two businesses, Sky Zone San Marcos and Sky Zone Carlsbad. They're family entertainment centers for kids and families here in the community. That's very personal to me. I had a daughter who was diagnosed with cancer at 10 months. She was a patient at Rady Children's Hospital, which I know is very dear to all of you on this call. I believe very strongly in philanthropy and in supporting the community of San Diego as a result. because that hospital in this community saved my daughter's life. And so I sit today on the board of directors for the Rady Children's Hospital Foundation, working with CEO Patrick. And then I also serve on the executive committee for Ronald McDonald House of San Diego on the ROMP team, working with CEO Chuck Day. So the reason I want to share an example today with the closure announcement that was imposed by the state upon our county, I know your hands are tied, but I do want to impose upon you the opportunity to hear what this does to a family and that people are beginning to lose hope. If our business was forced to close, as it is now, and will now be forced to close through the remainder of July, we will be potentially an example of that lost hope here in San Diego if we go out of business. Every single employee on our team will lose their job. The community will lose, in my opinion, one of the best parts of being a child, which is celebrating a birthday somewhere special. We hosted 1,924 birthday parties last year at our location, and that welcomed 25,000 kids from our community in to celebrate with presents and smiling. My wife and I used every penny we had personally to cover the expenses in March, April, and May when we were forced to close the first time. But that's okay.
Sir,
as business owners,
comments.
What's that?
I'm going to ask you to please summarize your comments. Your time is up.
Yep, as business owners, we did exactly what was required to cover those expenses. But the reason I share today is with this second closure, we will potentially be in a situation that our business is forced to close, losing 90 team members, an opportunity for children to have birthday parties in the future, and a very impactful part of our community. I know that the health impact is big, and I know that's on your shoulders, but I hope that you remember there are families just like mine in the community that are just as important as those health orders, and I think we can find a way to allow our businesses to survive. Thank you.
Thank you. Our next speaker is 1376.
Good morning, and thank you for giving me the time of the day today. My name is Ann Vandenhout. I am owner of Cafe Sevilla in the Gaston Quarter. And as a restaurant owner, I could take a lot more than 2 minutes to express the frustration of how we all feel to be put on the news and stating that all outbreaks are caused due to the restaurant industry. This is so unfairly treating many of us who have worked very hard after 3 months of closure and put a lot of money to make sure that all our customers are safe. One size does not fit all. Why would very hardworking operators who are really taking care of making sure employees and guests are safe at all times be looped with the operators that are not as efficient? We all know who they are. It was very interesting to hear about the outbreaks in the community regarding restaurants. Those restaurants are not restaurants. We are a dining establishment as well as a nightlife establishment. We have shut down our nightlife establishment and never reopened it since. Others, not as focused on the safety of all, have done so, and thus, here we are, shut down again. I have 4 tables on my patio. How am I going to survive again? How are we all going to survive? Understanding that it is hard for you to make decisions because this is now imposed. There's nothing else we can do. It is not going to be 3 weeks. Last time was shut down was going to be for 2 weeks, and we were shut down for 3 months. How many of us will survive after the many months, more months of shutdown? So what is going to be done in order to make sure that this industry that is falsely accused is going to survive? What can be done to ensure that we have space outdoors? How fast can this be done? How many tables can I put outside on the sidewalk?
Ma'am, I'm going to ask
Are we going to shut down?
I'm going to ask you to please conclude your comments. Your time is up.
Thank you. In closing, I would like to see what can be done. Forget about the past. It is the past. What can be done going forward to support us, the restaurant industry, and the faithful operators that have done everything as asked to ensure that we can survive. Thank you for your time.
Thank you. Our next caller is 1766.
Good morning. I'm Chairman Cox and Board of Supervisors. My name is Deborah Rosen. I'm the President and CEO for the North San Diego Business Chamber. I'd like to thank you all for the great job of communication, and especially Supervisors Desmond and Gaspar for the relentless work in making sure businesses get open and operate in a safe manner. Today, many of us are frustrated alongside our small business owners that are so critical in the region. Opening and closing a business is not easy, and it's had a huge impact on many lives. Let's look at these businesses that are being closed, opened, and closed again. They're owned by real people that need to and want to make a living to support their families, our families with jobs for family members, and they drive sales and tax revenues into the communities. When you close so many businesses because of a few bad choices made by some, it's had a negative impact on so many people. Why not cite all those that are protesting and not wearing masks? How come all of the restaurants and other businesses are being penalized for a few? Many businesses have done what you have asked, to reopen and invested thousands of dollars to be in compliance, only to be shut down again. Many of those are my members at the chamber. Dr. Wooten, I agree you have a tough job. I certainly wouldn't want it, and you've done a good job. But I'm confused about a statement you made about closing for 3 weeks instead of 14 days. I really would like to understand this better. With everyone being tested, of course, the numbers are going up, and this is not a fair representation, and in my opinion, has a negative impact on the restaurant industry as well as other businesses. With numbers going up much quicker than deaths, you should see this as progress. We hear about the age group of the 20 to 39-year-old population getting the virus, but we don't know how many are being hospitalized or even going into ICU. How come? These people represent 48% of our current rise in numbers. Shouldn't we know if they're mild cases or individuals with no symptoms? Too many people have suffered because of decisions made by a few. Please remember, when making decisions, one size does not fit all. Thank you so much.
Thank you. Our next caller is 2021.
My name is Caleb Dominguez. 4 months since Governor Newsom's declared state of emergency, we have no end in sight. We, the people, are fed up with the charade of fear and unscientific overreactive response that you continue to prolong indefinitely. This virus may have come from China, but you have created this crisis here at home. You severely underestimate the intelligence of San Diegans to do what's best for their health and decide what risks they want to take. The latest stats of our county, 387 deaths, that's a 97.7 survival rate. For 3.2 million San Diegans, you are destroying the economy for 0.012% of our county's population and left us with 50% of the workforce unemployed. Your oppressive policies in step with the governor revealed your true colors to ruin entrepreneurs, remove school choice, restrict medical freedoms, and First Amendment religious liberties. This agenda is being exposed. The socialist takeover will not succeed. The American people are awake to crooked, preemptive, backdoor laws like AB 262, granting dictatorial emergency power to every unelected California public health officer. The citizens of San Diego will hold every one of you accountable, and to paraphrase the Declaration of Independence, because you have overtly treaded upon our rights to life, liberty, and pursuit of happiness, your power derived by our consent will be removed by the same manner. Your actions to this point will not be forgotten. This is no longer left, right, or party issue, but we, the people, will always choose liberty over tyranny. You keep appeasing mobs, punishing lawful citizens, treading our God-given rights, and you'll find there is a price Americans will not pay. There is a line you will not cross. We will not permit your control of the economy, thereby the people. This COVID fear manipulation will not fool everyone forever. As you push your policies, I promise the people will push back in noncompliance and civil disobedience. Without your consent, we, the people, will exercise our ability to retain our sovereign rights, to make our own decisions, and determine our own destiny. Thank you.
Our next speaker is 2171.
Good morning. My name is Heather Pisani Crystal. I'm a librarian with the County Library for 11 years and a member of SEIU Local 221. As the County Library prepares to serve library users in person, I'm concerned for the health of my customers and colleagues. Many library users are from vulnerable populations, and many library staff are parents, grandparents, and caregivers in their private lives. None of us can afford to become ill from this unpredictable virus. We know that COVID-19 infections are a product of viral exposure multiplied by time, and we are discovering that time spent indoors with others is most dangerous. Under the proposed reopening, library customers would be able to spend as many as 2.5 consecutive hours using computers or studying in the library. This is far more time than most customers will spend in a single retail store. We have nurtured an atmosphere of home at our libraries, a place for county residents to be comfortable. But the novel coronavirus is no ordinary situation, and for the time being, we can't pretend that the library is as safe as one's own living room. To establish reasonable guidelines for library branch reopenings during the pandemic, the county must work with the union and branch employees who know how their libraries are utilized. We are not opposed to in-person services, but we want to plan them in a methodical way that acknowledges the concerns of library staff and the risks posed to the community. As we experience a surge in COVID-19 cases, we must choose the sensible thing to do: protect all workers and protect our communities. Thank you.
Thank you. Our next speaker is 2587.
Morning. My name's Carlos Hernandez, proud resident of West Chula Vista, and I'm actually calling in support of rental relief. It honestly is bizarre that there has to be advocate groups that need to remind you to invest in San Diego families, because one would assume that as public officials, you would inherently find it obvious to do so. But you only consider white or wealthy residents real San Diegans. And I'm sure you have a nice politician's response that explains otherwise, but the results are the same, because you prefer to listen to some British dude that wants to open a museum, hipsters that want to open breweries, and Karens that are okay with my family getting sick, all while the majority of working families can hardly afford food and are at risk of evictions. The difference between all of you people's world, while my community is traumatized, leaves me with a lot to think about as a young adult, because you might just not care. And that is what is most alarming to me, because you were supposed to be people that I look up to as public officials. So if you kick people out into the street, I honestly hope that your neighbors and loved ones know that the shameful thing that you allowed to happen. And if my comment makes you feel uncomfortable, honestly, good for you, snowflakes, because thousands of people right now are facing real issues like hunger and homelessness. So I'll step aside now so that Karens and Kevins can continue throwing their tantrum. Good day.
Thank you. Our next speaker is 2674.
Good morning. Good morning, Chairman Cox and Board of Supervisors. My name is Kevin Hopkins. I'm the Executive Vice President for Mother Earth Brew Co., headquartered in Vista, California. I'm also a past president of the San Diego Brewers Guild, and I'm calling today and commenting directly on the health order that was dated today, 7/7, and was mentioned earlier by a previous respondent from Little Miss Brewing. There is a contradiction that's contained within this order, and we would again like to bring it to your attention. Paragraph 14, sub-area C, says specifically that alcoholic drinks shall only be served as part of a meal and must be sold and served in the same transaction as the meal. All meals shall be served by a food operator permitted by the San Diego County Department of Environmental Health. This restriction shall not be applicable to outdoor service of wine at a winery or spirits at a distillery. The earlier comment misspoke slightly and said breweries instead of wineries. His intent, however, was clear. Precedent has already been firmly established by the Department of Alcohol Beverage Control and by the local city planning and business licenses adjudication vetting process to show that wineries and breweries and distilleries are essentially aligned. We are all kissing cousins. This contradiction is a violation of letter versus spirit. As mentioned earlier by Supervisor Jacobs and Chairman Cox, it is applaudable that Dr. Wooten provides evidence and science, and if evidence and science through the California Department of Health, which has then been ratified and published by the San Diego office, states that wineries and distilleries are okay to serve outside, then ergo, a duck is a duck is a duck. And so as long as the validation process is there to show that breweries do fit the same criteria as wineries and distilleries, then there should be no contradiction to this whatsoever. It's also been mentioned by two previous respondents today that you do not have a choice in this, and that it's mandated. Truthfully, and we all know this, you actually do have a choice. You actually have a choice whether or not to align yourself with the state guidance or not. Yes, there are prices and things. There are costs in all things in life. In order to receive subsidy and support, you need to be able to agree to certain restrictions. It is your choice as to whether or not to fight this and how to fight it best. Thank you so much for your time.
Thank you. Our next speaker is 3585.
Good morning, everyone. My name is Mark Sigmund. I'm a proud resident of Fall River, California, and I want to thank Supervisor Desmond for his tireless work to keep us all informed. The reason I speak to you today is because as a father, as a community member, I have seen friends, colleagues, fellow business owners struggle over the last 4 months. It is very, very disheartening to see them at the end of their shift, brokenhearted, whether or not they're going to be able to go to work and where they're going to be able to pay their next bill because of these restrictions that are being placed on them. They have gone above and beyond to figure out how to be sanitary, how to make sure that everyone stays at distance. And their biggest fear is that there is an outbreak in their establishment restricting them from being able to serve their livelihood. They have lived with this every single day. Now, through the actions of a few, they are now rendered hopeless. They don't know when they're going to be able to come back to work. They don't have a defined objective to say that we will only be here for 3 weeks. As was mentioned before, it was only supposed to be 2 weeks before, and it went into 3 months. We can stand in line for hours, hour and a half at a time because of Costco, Walmart, Home Depot. These large stores are not anywhere close to the sanitation guidelines that your local small businesses, retail outlets, restaurants have observed since this happened. Again, we do not know how many people are asymptomatic. We do not know how many people have been recovered from these cases. The only thing we do is we add to the case rate. Thank you for your time, and I really appreciate all of your hard work for our county.
Thank you. Our next caller is 3640.
Good afternoon, Mr. Chair, members of the board, Madam CAO. My name is David Garcias. I'm president of SEIU Local 221, representing 11,000 county workers. Given that just yesterday the county announced further restrictions on indoor activities, it's appropriate that the county has delayed the return of in-person library services. No one knows the value of libraries to our community more than the library staff we represent. It's precisely because of the confidence that our community has in library services that she should not give the public a false sense of safety by prematurely restoring in-person services. We are here to reiterate that the county should not move forward with in-person library services without establishing policies and protocols that put safety at the forefront. Employee input is critical, and our members have provided much for you to consider. I do hope you take our feedback and come back with a robust plan to protect our workers and the public. I also want to express my disappointment that Sheriff Gore is pursuing a reckless plan to contract out medical and behavioral health services to a for-profit corporation as we deal with the greatest public health crisis of our lifetime. If the sheriff hasn't taken the necessary care for incarcerated patients, we should shift the responsibility for their care and support of the incarcerated population to HHSA and retain the highly skilled staff who already perform these vital jobs. These are two different issues, but the theme is the same. The public depends on county services, and you endanger the public when you don't have the proper staffing and compensation to recruit and retain experienced healthcare professionals to work in these jail facilities. And you need thorough safety protocols to protect both workers and the public. You must do better for your workforce and the public. Thank you for your time.
Thank you. Our next caller is 3838.
Yes, my name's Michael. I'm calling from Ocean Beach. I would just like to reiterate all the comments that were previously made about this being a manufactured basically by cherry picking these numbers here, focusing solely on cases here when we're going through a period where we're vastly expanding the number of testing, and we're changing the definition of what is a case to anyone who has had contact with someone that has tested positive is now also considered a case. This is totally disingenuous for the doctor to be using these case numbers to solely, decide our public health policies here. I'd also like to just talk about the fact that this is a mental health crisis in the making here. I've seen the changes in my own sons and their behavior. They're both falling into kind of like a depression, just not being able to move on with life, being isolated from their friends. This is just going to be an ongoing and expanding crisis. And nobody is addressing those issues. I also would like to comment on the fact that, any of these things are all going to be voluntary there. Nobody is going to be forced to go back to work. Nobody is going to be forced to open the restaurant. Nobody's going to be forced to be around anyone that they think has COVID. This is all completely voluntary. And if the masks work to protect the essential workers, then why can't they work to protect non-essential workers and then the family that they go home to? This is absolute, just cherry picking the numbers and just total hypocrisy and all the nonsensical solutions here. From going from, we have to let prisoners out, but we have to put the homeless inside. That makes no sense. Indoor dining is not good, but yet we have to lock down everyone inside. The masks, only protect essential workers, but they don't work for non-essential workers. This is ridiculous, and you guys know it. And how do you look yourself in the mirror when you go home? And thank you for the Supervisor for all your support and everything that you've done.
Thank you. Our next caller is 3849.
Hi, good morning. This is Leslie Maslin, librarian with San Diego County and proud member of SEIU 221 and SHOP Steward. Our staff have been anxiously working with high levels of fear due to the current COVID-19 landscape. We have a moral responsibility to protect not just our staff, but also members of the public. County of San Diego needs to ensure libraries have the proper PPE equipment, sanitation supplies, and most importantly, that staff have the training on all procedures. We cannot and should not rush into full service without fully vetting the protocols. Ensure we minimize the spread of the virus and include our union as part of the bargaining process. Under management's current expectations for the since canceled July 6th reopening, staff would have had 4 days to absorb incohesive training modules, rearrange facilities, and master never before used protocols while attempting to deliver in-person services and manage 4 months of returns and operational duties with half the staff. In addition, most branches have had staff that have been reassigned as disaster service workers to care and shelters, drive-up testing, and Great Plates, some driving upwards of 400 to 600 miles a week to their work site without being able to claim mileage. The library department contributed by 3D printing 600 face shields for healthcare workers, but management will not provide them to library staff despite having the technology to do so. Librarians have been working frantically to adapt to new virtual platforms for story times, book recommendations, and summer learning, all well-loved services by the community. As businesses, schools, and other entities have adapted, we too must adapt and cannot go back to normal at this point in time. Dr. Wooten's words are especially true for the libraries. With the reopenings, people think we can go back to a pre-COVID existence, and we cannot. The library is not the library of 4 months ago, and we cannot be everything we used to be during this unpredictable pandemic, though we will do our best to continue to provide services. Up until Thursday of last week, we were still bargaining with the county on this topic. While we are not finished, we now have the time to go back and do this the right way without putting the community at risk. I look forward to returning to a full service model, but until then, our doorside pickup must continue as modified. We truly do miss our customers, and we all look forward to seeing them in the future, but we must be patient for now.
wear a mask, wash your hands, and protect all workers.
Thank you. Our next speaker is 3878. I think you're on mute. Could you please unmute your device? We're going to come back to you. Our next speaker is 0111.
Hi, my name is Jose Lopez. I'm an organizer with ACE and a member of the Invest in San Diego Families Coalition. I'm also a resident of District 1 in San Isidro, and I'm calling to ask that you support the Invest in San Diego Families demand. 5 years ago, I provided testimony for the first time at the county meeting, and I found out that there was over $2 billion of a reserve fund that was sitting there for an emergency, right? The emergency is here, right? And we're facing the consequences of all those years of neglect, right? Our communities are the ones that are hit the hardest, and we're also the ones that have least access to healthcare and housing. We're also the essential workers who risk their lives every day when we go to work. And before the pandemic, we were already struggling to keep up with the high cost of rent. Now it's worse. So we need the county to help supporting canceling rent and mortgage payments. Right now with your budget, you have an opportunity to invest in a rental assistance program to help those families that need it. We're asking that you invest $100 million to help families who can't pay their rent. This is the least that you can do. We know that it's not enough, but nobody wants to go back to work no matter what any of these people say, right? People just want to make sure that they're safe and that they have a house. If people weren't forced to pay their rent, they wouldn't need to go to work. So we're counting on you. You have the responsibility to make sure that people are okay, and you have the ability to do so. So it's you have to choose what side are you on, because we're watching you. Our kids are watching you, right? And we're not going to stop until we have what our communities need.
Thank you. Our next caller is 4451.
Hi, my name is Janelle Sisting, and I'm a small business owner in San Diego. I wanted to start by saying thank you to Supervisor Des Moines, as well as thank you to the medical community and our local government for all of the work you've done to support, monitor, and control this virus. My heart goes out to those who work long hours to keep the rest of us safe. I think we've done a great job in San Diego together at staying safe. One thing that I've noticed as a small business owner is that when we focus so much on one issue like COVID, there are issues that fall at the expense of this. So there's no such thing as a free lunch. Any effort exerted for one cause will detriment the other. Right now, many small businesses and shops are suffering, and they're at the risk of closing for good. There's many people who also depend on these shops and use these shops to feed their families. I have a business located at 1414 Garnett Avenue. I've personally spoken with many local business owners who have expressed a feeling of exasperation and fear that they and their families will lose what they have worked their entire lives to build. It is clear to me that the risk and effects of this virus are better understood now than ever before. I have looked at hospitalization rates. I see the downtrend in hospitalization rates and the death rates. I've also seen how business owners and patrons have stepped up in San Diego to maintain healthy work and commerce practices. However, I also see the recent shutdowns as heavy-handed actions by Governor Newsom. They're not specific to each type of business, and it's also not applicable, I believe, to San Diego, since we are showing the decline in death rates and the decline in hospitalizations. As our San Diego board, I ask you, please resist these heavy-handed measures by Governor Newsom to ensure that we come out of this crisis, that small business owners and their employees have a place to come back to. While closing restaurants, we are only hurting the most vulnerable wage earners amongst us, while only slightly decreasing the risk.
Thank you. Our next speaker is 4497.
Hi, good morning. My name is Angie, and I'm calling from San Marcos.
I'm just calling in wondering why our goalposts are moving. When we first started this pandemic, we stayed home because we were building up our hospitals so that we could have a surge when we knew when we reopened, we would have a surge of cases and they would go up. But it seems like we had a little tiny bit of surge in California. And now all of a sudden we're starting to close everything down again. It just seems like every time we go through the process, the goalpost moves. First it was 2 weeks, then it was a month. I mean, we're 4 months into this. This is crazy. We need to find a way to go about our lives and be able to open up safely. I mean, and I'm wondering if our shelter in place was really working, why were deaths, if you go on a month-to-month basis, just as high and higher than it is when we reopened? You can look at the data. I've been following the data since day one when you guys have been showing it. And I'm also following the data, noticing that 9.6% of our cases are people that are over 70, and they're accounting for 72% of our deaths. That's 278 of our deaths are people over 70, and they're only 9.6% of our cases. So shouldn't we be helping those people to shelter in place and us getting herd immunity with the healthy out there doing that? It just doesn't make sense. And also that showing that nursing homes are 46% of our deaths are coming from nursing homes. It just doesn't seem that we should be sheltering in place that way, that we should be getting herd immunity because we don't even know if we're going to get a vaccine. I mean, there's been no vaccine for coronavirus in the past. So we need to find a way to deal with it and deal with it in a healthy manner, not keep shutting businesses down because people that are in those businesses are not even going to be able to get unemployment within those 3 weeks. I mean, they're so backed up. By the time they get on unemployment, they supposedly will be able to be open again. It's just crazy. And then one other factor that's being left out of this is our youth. You guys have been asking for months and months on end for the governor to give you some guidance on youth sports and to get our kids out. And you have had no response from him. When are you guys going to say this is enough? Our kids need to get out. It's summertime. It's hot. The virus doesn't last. We need to get them out and doing things. Thank you. And I appreciate Gaspar and Desmond for all they've done. Thank you.
Thank you. Our next speaker is 4728. 4728.
Hello.
Hi there.
Yes. Hi. Hi, my name is Sylvia, and I'm an organizer at ACE and a member of Invest in San Diego Families Coalition. And COVID has been able to show the inequalities of San Diego all the way from the north to the south. The community is not keeping their needs a secret, so I urge all the supervisors to listen and prioritize the community demands and invest $100 million into rental assistance. Something needs to be done to avoid the flood of evictions coming after this, and we need to make sure that we keep families sheltered and safe. Because while this pandemic was no one's fault, some families have been struggling for around 4 months, but my community has been suffering for years. This is not a new fight, and we will continue to be here, and we will continue to try to get supervisors like Desmond and Gaspar to consider prioritizing communities over profits. Families are suffering, and instead of throwing people back into unsafe environments, we need to make sure tenants and workers have a safe environment during the global pandemic, which is affecting people disproportionately. And I really hope you all listened during the presentation earlier and that I don't have to remind you which communities it is affecting the most.
Thank you. Our next speaker is 5403.
Hi, my name is Matthew Zerpolo. I'm the owner of Virgin Beer Company. I'm also the president emeritus of San Diego Brewers Guild, which represents over 150 small businesses in this county. We understand the need to close indoor consumption, but would like to see consistency among brewery tasting rooms and winery tasting rooms, as well as a sustainable plan moving forward to avoid future closings and restrictions. Inconsistent openings and closings of brewery tasting rooms are incredibly detrimental. The loss of thousands of dollars in revenue each time restrictions are applied. There's a lot of time that's needed to produce beer. The need to be notified further in advance of openings and closures is paramount. Customers don't know if tasting rooms are open or not, which increases the fall off of number of customers. And this has a massive impact on our employees whose jobs are jeopardized with every restriction. Before the restrictions yesterday, brewery tasting rooms were not the problem, so why were previous restrictions applied? No brewery tasting rooms have been implicated in the spread of COVID. Our industry has a thorough understanding of sanitation protocols, and most are abiding and enforcing all safety policies. With the new health order, why are wineries and distilleries allowed to open for outside consumption without food? Both wine and spirits have higher ABV than beer. We believe that wineries and distilleries should not have to serve food, but rather breweries should not have to serve food in conjunction with the sale of alcohol outdoors. We want these restrictions to be consistent among breweries, wineries, and distilleries. We would like to generate a plan moving forward to reduce the need for additional restrictions and keep us open. As we close for indoor consumption, we need to come up with a proactive and effective plan moving forward. We need to ensure the plan is sustainable and we can use other countries for reference. Once again, we would like to govern with a scalpel, not a grenade, as Supervisor Desmond said. We need to punish those not enforcing safety policies and regulations, and do not punish an entire industry, especially one without violations. Thanks for your time.
Thank you. Our next speaker is 5595.
Hi, my name is Steve Munson from Dos Desvelados Brewery in San Marcos. I thank you for the speaker previous to me. I agree 100% with what he's saying. I won't repeat everything about Order 14C. It just doesn't pass the smell test. Our business is not sustainable under these current health orders. We're not a restaurant. We're not a bar. Please consider us to be, like I said before, the same as the wineries and distilleries. I got to thank especially Alcohol Beverage Control, the City of San Marcos, Supervisors Gaspar and Desmond for their support. Thank you.
Thank you. Our next speaker is 6789.
Hello.
Hi there. You may proceed.
Okay. Hi. Thank you. Good morning. Good morning or good afternoon. My name is Patricia Mendoza, and I'm calling you today because I'm demanding that you assist working families like me of San Diego County. A little background: I'm a single mother of two. I used to work for a non-emergency medical transport. I lost my job March 26th. Haven't paid my rent. I've had to use my unemployment to pay gas and electric, to pay internet, to buy food. And it's really sad how nobody's caring for our low-income communities. I'm scared, and I don't want to fail as a mother and tell my kids I will be homeless or we will be homeless. I have a compromised immune system. It's really hard for me to go out there and find a job. So I am begging you, I'm actually here today, so you can please listen to families like mine. I've worked hard. I've had 2 jobs to make ends meet. And many of us haven't been able to work for months. We need this immediately because we cannot survive without food or a roof over our heads, especially throughout this pandemic. We need rental relief. We need to cancel rent now. We deserve a decent way of living. No one has ever said, we need to respect this pandemic, and we do. We need to respect it. When you know that your neighbor's brother and sister got sick because of this, when it's too close to home, this is where it hits. I don't want to tell my kids they're not going to have a mom anymore, that I'm not going to come back. So please, just listen and respect the pandemic like we respect you. Respect us back. We need this. We need this help. I'm crying to you today because I'm a parent of 2. You guys are parents also. We need this help. Thank you so much.
Thank you. Our next speaker is 7194.
Hello, my name is James Anderson. I live in Ms. Jacobs' jurisdiction. I don't know how much I can agree wholeheartedly with the rest of the speakers that have given public comment. As a person who lives with a disability, as a person who has a hard time putting a mask on, I can respect and thank both the county and the state for making that exemption for people with medical conditions to not have to wear it. That being said, with businesses now being closed, with those businesses that followed the guidelines that to a T, such as those in East County, that, bowling alleys, whatnot, to have to close them again, potentially put their employees in a financial strain where they may become homeless, as a lot of the speakers have already said, is absolutely unacceptable. You have the right as supervisors to make the decisions for the people. Ms. Jacobs, Mr. Cox, I know that you 2 are terming out at the end of your term here shortly, but for the rest of you, realize that your jobs are at stake because the voters can vote you out as fast as we voted you in. you are not representing the people to their best of ability. I also want to bring in the fact of MTS, and this is directly related and directed towards Mr. Sorry, I'm flaking on the name. But anyhow, MTS has not gotten down as fast as they should have with educating their employees on the exemption for people with medical conditions. I have talked to their ADA attorney. I have talked to customer service on more than one occasion. The employees, buses, transit, everything need to be educated. Remember, you can be voted out as fast as you're voted in. Thank you very much.
Thank you. Our next speaker is 7436.
Hello, my name is Keith. I live out in East County, unincorporated portion of East County. And I've been watching the COVID situation and have been looking at the statistics on the Union Tribune page, usually a couple of times a week, sometimes 3 or 4 times a week. At this point, I am fortunate enough, I do not know anybody who has contracted COVID, but I do know plenty of people who have been affected by the shutdowns. And I believe, as some of the other callers have stated, we were all extremely supportive of the shutdown and staying home in the early portion of this pandemic. But I think we do have enough statistics now to know where we're headed, what the effect is. So I want to talk a little bit about statistics. I have a science background, and statistics are statistics. But the important part of science and statistics is drilling down and understanding the reasons behind them, so appropriate actions can be taken. I'm concerned that you as supervisors and our elected officials have been somewhat lax in that regard. With that said, I do applaud both Supervisor Desmond and Gaspar today for the questions they asked of Dr. Wooten in trying to understand more, in more detail, the statistics that she presented today. I happened across an article dated July 3rd from a doctor in LA County a couple of days ago. And he showed 2 graphs, one showing the number of cases going way up and the number of deaths going way down over time. And he offered several explanations for that. But the dominant reason he believes is the increase in infections is now affecting much more younger group of people, for which the implications of getting COVID are considerably less. I would urge you as the supervisors to look at the data, look at statistics, drill down, understand the statistics, and explore alternative strategies that target the vulnerable groups, and less strategies that blanket orders affecting everybody, including all the businesses across the county. Thank you.
Thank you. Our next speaker is 7646.
Hi, my name's Kelly Lauro. I'm calling today, first of all, to thank the supervisors for the hard work they're doing. And Wilma Wooten, I know your job is hard, but I think you could give us a little more perspective. And that's what I want to talk about is the numbers. I just don't feel they add up to a full lockdown of our economy, which includes so many small businesses, schools, and recreation. Particularly on the death count numbers, deaths are tragic, but you need to put them into context so the public is not alarmed and panicked. Let me look at specifically April 2020 number of deaths in San Diego County. By the numbers you reported for death counts on COVID, there were 113 COVID deaths in April 2020. From your own reporting, there were 1,988 total deaths in San Diego County in April 2020. What are the other 1,875 deaths attributed to? People die every day in San Diego County. It is tragic, but it is the way of life. You are locking people up, making them wear masks, telling them they can't play football on the beach or have a barbecue in their own backyard because 113 people out of a population of 3.5 million died in 1 month from COVID, which is a very small portion of the population. And only 5.6% of the total 1,988 deaths in San Diego County in April of 2020. As of July 5th, you report that there are 387 deaths, total deaths from COVID, which is cumulative since you started counting in March. and that is only 0.01% of the population of San Diego County. Again, people die every day in San Diego County. The average number of deaths per day in 2018 was 66 people per day. Every death is a tragedy, but people die every day. No amount of lockdown or mask wearing or social distancing will prevent death. Public health officer. Oh, I have so much more to say about your case counts. Are they asymptomatic? Are they actually positive antibody tests? How many were double, triple counts of the same individual? This is the
Your time is
information
up.
we
Can
need,
you
not
please do one
cumulative
concluding
numbers.
sentence? Your time is up.
Please, San Diego County Board of Supervisors, terminate the local health emergency, fight with Sacramento, end the stay-at-home order, and get our freedom and our county back. Thank you.
Thank you. Our next speaker is 7872. 7872.
Hi, can you hear me?
Yes, we can.
Hi, my name is Allison Hartman. Hello, elected officials of San Diego. I'm a proud free citizen of the United States of America. I'm calling today to question the state of emergency and lockdown orders. I'm a single parent and have lost my job due to the lockdown. I don't know how and when I will be able to earn an income, and that is very stressful to say the least. But today I'd like to review the law of the state of California. According to California Emergency Services Act, Section 8558-B, a state of emergency can only be called if the threat overwhelms the current resources of the state. Further, the state of emergency has to be terminated at the earliest possible date. San Diego has currently begun accepting COVID patients from other locations, specifically Imperial County and Mexico, that we know of. This is good news, as it means that our resources are not only sufficient for San Diego, but robust enough to accept patients from other locations. Additionally, thousands of healthcare workers are being furloughed in California, so there is zero evidence of grounds for state of emergency based on public health. Therefore, the basis for the state of emergency is invalid and unlawful. See Section 8558B. As we have clearly seen, our resources are not only not overwhelmed, they are so plentiful that we have laid off healthcare workers and are able to handle overflow from other areas. Therefore, according to California law, the grounds for the state of emergency doesn't exist. Therefore, the current state of emergency in California and San Diego is invalid and unlawful. According to definition of state of emergency, we are no longer under one. Therefore, these orders should be immediately terminated, including stay-at-home orders, social distancing, closing of schools and businesses, and mask wearing. To those people that would say we are closing things to save lives, I would say that the economy is live. We need to reopen. People need to be allowed to go back to work. Thank you very much.
Thank you. Our next speaker is 8392.
Hello. Good afternoon, Board of Supervisors. My name is Martin Verling, and I am here to speak on behalf of Dr. Wilma Wooten. I'm a white man concerned that white people in this county are putting out a call to bring harm to Dr. Wooten. She is doing her job, nothing more. It must be very frightening for a Black woman to know that there is a call for her white to visit her home in anger. I want you all to think about what this is a reminder of in our American history. Please stand down. I am asking the county to provide security for Dr. Wooten. Thank you.
Thank you. Our next speaker is 5989. 5989, you may proceed. If not, we'll go on to 9208.
Hi, my name is John. I would like to know how many of the 2,736 positive cases were asymptomatic. How many were actually positive antibody tests? How many were double, triple counts of the same individual taking the test several times? How many went to the hospital? Of the 127 by their own data, which is 4.64% of the cases. How many of those went to the ICU? 30 which is 1.1% of cases. How many deaths? 23 deaths that week. That is 0.0007% of our county's population of 3.5 million people. Why are we still under lockdown? The numbers don't add up. If you cannot tell us what the individuals of these counts, how can we take them seriously? Give us aggregate data is useless. If the current new cases are mainly healthy, asymptomatic young people, isn't that a good thing? Won't that help us get to a herd immunity faster? Staying locked up is not helping our immune system learn to fight off the virus. Take care of the elderly, those in congregate living situation, and those who are underlying health conditions. Let the rest of us live our lives. We have never locked down for the flu virus before. Flu deaths spiked in 2017 and 18. There were 343 deaths of the 833 cases. And yet there were no shutdowns, no mask mandates, no jobs lost, no businesses shut down forever. This is a huge overreach of the government into my freedom. You are shutting down the most of our economy. Small businesses and Americans should have the right to choose what risk to take and what risk not to take. We should not be told by the public health officers or government officials what we can and cannot do. Lift the health order and remove the mask guidance mandate now. Fully open San Diego.
Sir.
Enough is enough.
Sir,
Thank
your
you
time
for your
is up.
time.
Thank you. Thank you. Your time up. Thank you. Our next speaker is 4786.
Hello, my name is William Wright, and I am calling on behalf of my wife and myself, who are longtime residents of Supervisor Diane Jacobs' district. As senior citizens, we are especially vulnerable to the deadly effects of the Corona-19 virus. For our sakes and for the safety of our community as a whole, we implore you to enforce mask wearing and social distancing requirements. As a senior San Diegan, I have spent decades contributing to our county, paying taxes, volunteering, and raising my children and my children's children to become productive citizens of our county. As a Navy veteran, I served our country overseas in wartime. While I do not feel anyone owes me a debt of gratitude, I would hope that my life deserves a minimum amount of respect. I believe that respect for my very breath outweighs some person's selfish desire to ignore the risks of COVID-19 and to refuse to abide by mask and distancing requirements. Please do not encourage their behavior. Wearing a mask slows the spread of coronavirus and has been recommended by our public health officer, our doctors, and by our trusted epidemiologists. I have heard many fellow San Diegos saying that wearing a mask violates their freedom, but our freedoms as Americans also includes responsibilities to maintain life and liberty. Social distancing requirements also slow the spread of coronavirus. COVID-19 is not the flu. It is not a hoax. It is a real and dangerous disease, and it's killing San Diegans. COVID-19 also causes severe, long illness and permanent breathing problems. We are in the middle of a national crisis, and these are the steps we need to take to gain control of our economy and our lives. Thank you.
Thank you. Our next speaker is 9364.
Hi, good morning. This is Michelle Krug, and I would like to emphasize the comments that were made earlier about Dr. Wilma Wooten. I also am very distressed at the what is happening with her and the danger that she's been put in, and recognizing how much this really shows about what's going on in our society. So I do hope that actions are being taken for protecting her and for us to be thinking about the significance of that. I wanted to speak about the Persons with Disabilities Commission from the county. I've spoken before how distressed I was that the county did not hold those meetings for 3 months during the most critical time of this COVID situation. And now Todd Hood is being asked to have a presentation at our July meeting, which is the 3rd Friday of this month, to tell us what is the county planning, how are they doing outreach into the disability community, because I know I had a lot of challenges at the beginning of this whole situation. And I know that no outreach was done that I could access. So, but he is not being responsive about that. And anything the supervisors can do to help facilitate this advisory group, because it is a county advisory group specifically for this purpose, to be able to do our outreach into our community, to bring back issues and concerns and ways that we can help facilitate dealing with them. I know our commission would very much appreciate, or our advisory group, the persons with disabilities. So again, it was very stressful that those meetings were not held. And now it's more stressful that they are not trying to help us understand so we can help facilitate changes. Thank you.
Thank you. Our next speaker is 9713.
Hi, good afternoon. My name is Eduardo Saldivar, and I'm a lifetime resident of South Bay, San Diego. I'm calling today as a member of ACE and the ISDF Coalition, as well as a resident of San Diego, to implore this body of people that are supposed to be looking out for us as San Diegans, but don't always seem to be doing that sort of thing. So I'm calling to implore for rental assistance. A lot of the stress that's coming through this, but not being able to work, is due to the fact that they have to pay rent. If families do not have to pay for rent or are not pressured by that, there will be an increasing stabilization of our families' health as well as our community health, because we all know that in a pandemic that people in minority groups are more susceptible to lifelong damages. And so I think it's fair trade-off to say that we could postpone a birthday or do it next year instead of having to have that same parent be able to be with that kid next year, as opposed to dying for the COVID. So please help with rental assistance and abide by the ISDF demands. Thank you.
Thank you. Our next speaker is 9719.
Aló, muy buenas tardes. Translate, please.
Un momento, por favor.
Sí.
Gracias. ¿Puede continuar?
Sí. Muy buenas tardes a todos. Me llamo Javier Parada. Llamamos hoy para pedir que ayuden a las familias trabajadoras de San Diego.
Good afternoon. My name is Javier Paradas. We are calling today to ask for help for working families in San Diego,
Ya que muchos de nosotros no hemos podido trabajar por varios meses.
since a lot of us haven't been able to work for a number of months.
Necesitamos esto inmediatamente, ya que no podemos sobrevivir sin comida o techo.
We need this help immediately, since we cannot survive without food or a roof over our heads.
Sobrevivir sin comida o techo, necesitamos ayuda de renta. Necesitamos cancelar los pagos atrasados.
We, in order to keep a roof over our heads and survive, we need you to cancel rent as well as past rents that might be due.
Merecemos una dignidad de vivir.
We deserve a life with dignity.
Y gracias por escucharnos.
And thank you for listening.
Thank you. Our next caller, we're going to go back to 3878. Please unmute your device if you'd like to address the board. 3878. We still can't hear you. It looks like your device is still muted. How about 5989?
Hello, I am a registered nurse working in Supervisor Gasper's district. I'm a mother of 2 school-aged children, and we live in Supervisor Jacobs' district. My name is Amantis Wright, and my friends call me Amy. I'm a lifelong San Diegan. I'm grateful to have the time to make my voice heard today because I spend 12-hour shifts working in the hospital. I care for fellow San Diegans of all ages, ethnicities, and economic status. I wear my mask and maintain social distancing from my coworkers the whole time. I wear a mask and social distance outside of work to slow the spread of COVID-19. I'm calling to ask for your leadership in maintaining these measures for the welfare of our county. I know the doctors I work with that COVID-19 is a serious, deadly, and unpredictable virus. I'm calling on behalf of all the nurses who are busy right now caring for others and can't call. I know from my friends and neighbors that our economy and livelihoods are suffering. I know from my daughters and from their teachers that our children are missing crucial social and educational opportunities. I know that this is a stressful time to try to stay afloat while staying home to slow the spread. However, as a responsible citizen, parent, and nurse, I know that we cannot forge ahead with life as normal until we can control the spread of the virus. Our businesses won't benefit if their customers and workers are sickened or dying. Our schools cannot function if our teachers and children are asymptomatically spreading disease. Our families can't get together to celebrate birthdays, weddings, and graduations until we have adequate testing, tracing, and control measures. An unrestricted opening means that my hospital will be too full to care for those of you who will need care for heart attacks, strokes, and accidents. We won't have enough ICU capacity. I don't want to follow the example of other cities with refrigerated morgue trucks idling outside. COVID-19 can spread from seemingly healthy people. Our case rate is increasing. When the death rate increases, it's too late. Even when COVID-19 does not kill, it often causes months-long severe illnesses and irreversible lung damage. We're learning more about the virus every day, and we need to act according to the best guidance of our public health researchers. The economy needs financial support, but we have to prioritize human life. Wearing a mask and distancing is a sign of respect for our fellow San Diegans. Those I see refusing to act responsibly because you think that this will only harm someone else, you are acting despicably. The lack of respect for the lives of our fellow citizens is not pro-life, and it is not American. The disregard for the lives and health of our Black and brown and elderly neighbors is not Christian, and it is not American. Supervisors, please act as the leaders our county needs now. Please enforce wear a mask measures. Please enforce social distancing measures. Please slow the spread of the coronavirus. Our lives are in your hands. Thank you.
Thank you. Now we're going to move on to the callers whose numbers were not recognized. So if you could please state your first and last name for the board, and you'll have 2 minutes to address the board. Again, this is on item 4, the COVID-19 update. So if you do not wish to address the board on this item, please hang up and call back when your item is introduced for discussion. The first one is 0687.
Hello, my name is Bradley Bang, and I live in National City. And the reason I'm calling is because I am very concerned about all the renters we have, low-income renters who are unable to pay their rent because of the COVID-19 emergency. I think these are the people who've been really the victims of this pandemic, and I would like to see the council please support the assistance fund for them. I know that they're currently asking for $100 million, and that probably still would not cover the amount of need that we have in our communities. The one other thing I wanted to mention concerning COVID-19 is all the people who are complaining about their businesses being closed down, that the people who are suffering the most from this epidemic are people of color. They are by far the majority of deaths from this disease in our communities. And that kind of talk is totally ignoring these people. We just want to ignore who is really suffering from this pandemic. And it is just, I can't believe that our society is thinking about their making money and capitalism and that when we have such an emergency on our hands. Thank you.
Thank you. Our next caller is 9791. 9791, did you wish to address the board? Okay, we will move on to 3583.
Hello, could you hear me?
We can, thank you.
Okay, perfect. So my name is Anais Alegria. I am an educator in the South Bay Union School District. And I just wanted to share a quick story really quick. So last week, my dad my dad is a senior, he's immunocompromised. We went to a local food bank because I haven't been working and he's a senior, he is retired. And we were turned away because there wasn't any more food. It had been less than an hour and the local food bank had run out of food. And I just want to put that into perspective because people can't afford food right now because we can't go to work. We can't go to work because, as Dr. Wooten has said, and the nurse that was on the line, it's dangerous. I understand that many people want to work, but right now, as we see in Georgia, in Florida, in Texas, and even in our neighboring Arizona, the rates are skyrocketing. People are getting sick, even if they're not showing them being sick, even if we're not seeing them having all these symptoms, they are spreading it. And I don't want anyone to overlook the deaths that are happening or the people who are getting hurt. I've seen my students struggle with homelessness. And right now, a lot of people are afraid of losing their homes because of the rental debt that will happen after the MOU is done. So please, I see that we talked about the funds. If we could invest in our families, invest in the San Diego Families County budget demands, we need to help our homeless. We need to help the incarcerated. We need to help our immigrants. Yes, the small businesses, I understand that you want to keep working, but are you really willing to put people's lives on the line? We need rental relief. We need relief for small businesses, and we need our community resources to be funded. Please invest in them. Thank you.
Thank you. Our next caller is 6631.
My name is Barbara Pinto. I'm a member of ACE. I live in District 8. This is the hardest hit area for the virus and unemployment. There are some areas of South Bay where there's 40% unemployment. I am over 73 years old. I'm paying over 82% of my income for rent. Our organization has asked for funding to support affordable and available housing for years. This problem has not gone away. Now we're on the top of the list for need because of existing hardships and now the coronavirus, which is widespread. This adds to our hardships, to our struggles. We are not prepared. We have no vaccine, nor do we see any end in sight for this pandemic. How can businesses be open safely? How can our schools be open safely for our children and grandchildren? People have gone back to work and the virus has spiked. We are asking for $100 million in aiding and supporting our communities. Please invest in San Diego's schools and communities now. Cancel the back rents and mortgages. There's no way people can pay double, triple, and quadruple rents when this epidemic is over. If it is the responsibility of our leadership to meet the needs of the people. We are counting on your support. Thank you.
Thank you. Our next caller is 2258. 2258, would you like to address the board? We will move on to 8021. 8021, would you like to address the board? Okay, we will move on to 6672.
Hello, hi. My name is Dalia Balmer, and I live in Rancho Penasquitos. I'm just calling in support of Dr. Wooten and all the public health officers and the Board of Supervisors that are supporting these efforts, to really keep us safe. It's frustrating to be at home and restricted, but it's not the end of the world, as many San Diegans, many of whom are white San Diegans who would like us to believe otherwise. I'm listening, and I'm trying to listen to understand, but I hear cries of the numbers don't add up, Wooten is fabricating, she's not credible, this is not valid, it's unlawful. And these are all, and I'm trying to say this as respectfully as possible. These are coming from individuals who are self-proclaimed experts, and I'm doing that in air quotes. That is the overreach that's happening, not the expert decisions made by our public health officers, our governor, scientists, et cetera. I'm a small business owner. I understand the pain. I've got a 15-year-old. He's bored. He wants to see his friends. He will be fine. He's going to be fine. I empathize that he's also coming from a level of privilege where he's used to having all this endless mobility and freedom. But we have to look beyond that. In fact, COVID is hitting our low-income communities disproportionately. And this has been because pre-COVID, some of our city and county officials have failed to address the underlying systemic issues that exaggerate COVID. So I would suggest that instead of criticizing the lockdown, please place all your efforts, all that passionate expression on closing those disparities and helping areas in order to prevent this from happening again. And I'd like to close by just saying that I am one of the writers of a letter that went to the Board of Supervisors and the sheriff supporting Dr. Wooten. And as a Black woman, I also wanted to express the extreme concerns that we had. That over 70 of us signed this letter and included several organizations, including individual people, about the micro insult, macro insult that were in the form of disrespectful comments to Dr. Wooten. If this predicates upon the belief that Black women are inferior and not suited to work higher ranking positions. And in addition, providing her address placed her in a risk that sends a clear message to those who may want to just, think of coming to, bring her harm. And so I want to make sure that the Sheriff's Department and the Board of Supervisors take this seriously and also stand for what is right and stand behind Dr. Wooten, because she's doing everything to keep us safe, to keep all our families.
Please summarize your comments.
Oh, thank you. That's it.
Thank you. Our next speaker is 2258.
Hi, my name is Shania Sisson-Porciaga. I'm a server in the Chula Vista area, and we need masks and social distancing. As a server, my coworker tested positive for COVID-19, and management kept it a secret from us. The restaurant was never closed for a cleaning, and no one was advised to take a test, although we are all in close contact with unmasked patrons. These corporations do not care for our safety or our health, and we need our local authorities' help. Please help us with rental assistance. Please enforce the masks and social distancing. Thank you.
Thank you. Our next speaker is 3064.
Necesito traductor, por favor.
Un momento.
Gracias.
Gracias. ¿Puede continuar?
Sí, buenas tardes. Mi nombre es Marta Orozco. Soy voluntaria en Employee Rights Center y estoy hablando en representación de ISDF, invirtiendo en las familias, y la verdad estoy muy decepcionada del gobierno que tenemos. No es posible que le den tantos fondos a la policía para que nos maten y no tenemos para pagar la renta, porque yo no tengo trabajo. Yo no voy a regresar a trabajar pronto. ¿Cómo voy a pagar mi renta? ¿Cómo voy a comer? ¿Cómo voy a subsistir? ¿No le estamos importando al gobierno de San Diego? ¿Qué vamos a hacer con tantas deudas? ¿Cómo vamos a salir de estas deudas? De verdad es muy triste y muy desagradable que la salud y protección para los trabajadores no les interese, que sigan los contagios, pero que la policía tenga mucho dinero para seguirnos matando. Es increíble la poca sensibilidad que tiene. Muchas gracias.
Ok. Señora, si nada más me puede repetir dónde es voluntaria, por favor.
Soy voluntaria en Employee Rights Center y en Invirtiendo en las Familias de San Diego.
So my name is Marta Orozco. I'm a volunteer for ISDF, and I am very disappointed in all the money that is being invested in the police and disappointed in the efforts that have been taken on by our government. And we are putting money in to police forces that kill us instead of giving us money for rent so that we can survive. Right, currently I can't afford my rent, I can't afford food, I have no job, and even then, you know, you are putting the funds where they don't need to be, but rather instead of helping us pay our rent, and now we are in mountains of debt, and I'm not sure how I'm ever going to get out of debt. And how are we going to survive all of this? And we are extremely disappointed in our government system. Gracias.
Te agradezco mucho. Sí. Muy buena traducción. Te agradezco mucho. Gracias.
Gracias. Our next speaker is 5464.
Hi, good afternoon. My name is Natalie Scott. I am a single mother. I'm a local business owner in the area. I have lived here for 12 years. I am the only child of a South American immigrant, and I'm extremely disappointed in how things are being handled right now. I feel like there is a lot of confusion in the way that information is being presented to the community. I understand that we have obligations as a county to obey our higher government, starting with our governor and then with the president. But at the same time, I just encourage you to listen to the people of the community. I'm hearing so many people struggling, so many people eager to work, people eager to eat, which they can't afford to do if they're not able to work. As a single mother, I have myself obtained food from food banks in the past, and they have been an incredible resource. So I'm also, my business is in a pool, I operate a pool service business. And I'm very confused why pools are not allowed to be open when it has been shown scientifically that the virus immediately kills with any presence of properly maintained pools. It is the only resource that I have to provide my children an outlet, a physical outlet during this time, but in the community that I live in, we're not allowed to open our pool. And I'm concerned about the outlets that families have during this time, the stress outlets, the opportunities to be out and about. I'm concerned about stores that are not allowing patrons to come in without a mask that have breathing problems. If these masks do in fact work, then they shouldn't be harassed. Also, I just ask that, I'm going to conclude it right there because I heard the beep, but thank you very much. And I really respect what you guys are doing. I want to thank you for doing probably one of the most difficult jobs I've ever seen in my lifetime. And I want to see this not to become a socialist environment, because I have seen firsthand from my mother what she had to go through in South America. Thank you very much.
Thank you. Our next speaker is 4920.
Me. Hi, good afternoon. My name is Eric Joyce. I am a father and an educator and an Oceanside School Board member. First of all, I want to thank Dr. Wooten. It is extremely disturbing to hear the anti-expert sentiment that's going on. And as an educator, it's really concerning because we've got to invest more in science. You hear complaints about ruining businesses for low death numbers, but our death numbers have been low because of the restrictions that you all have put in place, and the same restrictions that are now being lamented again. So I want you to keep up the good work, and thank you for working for us. If people want to go back to business as usual, they need to lead by example and wear masks. I'm urging the supervisors to refrain from twisting data to fit a narrative that pushes us to reopen too soon again. The subtle undermining of our own dedicated health professionals is a serious problem, and the whistles that are being put out are being heard by your constituents. Finally, I want to offer my support for Supervisor Fletcher's proposal to invest in testing through and at our K-12 schools. It is through our schools that are the key to building the future and getting us back to some sense of normalcy. My heart goes out to the businesses, but please invest in our schools and invest in the future of our communities. Thank you.
Thank you. Our next speaker is 5888.
Hi there. I am a San Diego Zoo employee, and I'm calling on behalf of the concerns that I and my fellow coworkers have. Mayor Falconer visited the zoo on June 19th. Convenient since that was the day before we actually opened to the public. The zoo publicly opened June 20th. He praised our new health guidelines and policies put in place to keep then the then limited crowds safe and healthy. Unfortunately, our visitors don't see it that way. They view masks as an entrance ticket and remove them when out of sight from employees in the main plaza. And social distancing is close to impossible when family groups block entire pathways of our 100-year-old zoo. Given Governor Newsom's instructions yesterday, the zoo has decided to shut down gift shops and restaurants throughout the zoo. We're already operating at half capacity. There's no way we're making enough money to maintain zoo grounds, maintain crowds, care for the animals, and paying all employees who are reporting for work. What we are doing is putting our lives at risk for a non-essential operation. The San Diego Zoo is the best rated zoo in North America for a reason. It attracts people from all over the world and even more now since it's the only open park in Southern California. The people who have been visiting us for the last 3 weeks have overwhelmingly shown no regard for their own or our safety. Being an open air zoo helps, but there are still railings, there are still windows, tables, offices, and doors to be open. I personally work in a ticket booth where I touch computers, guest IDs, phones, and membership confirmations. And when all of this is brought to the attention of our supervisors, we are repeatedly shown that the zoo's liability has higher priority than our health. Many of my peers, like myself, work part-time and we are not offered health insurance. We aren't even receiving hazard pay. June 3rd, the zoo informed us that an employee had already tested positive and was last on grounds June 30th. This is proof that no matter what procedures they put in place, they can't protect us. And it's not a question of if, but of when. And exposing us to such large crowds from not just our local community, but from other counties and states will only accelerate that. We were reporting less than 20 new cases of COVID-19 a day when we closed. We're reporting several hundreds for the last week. It seems irresponsible and careless to expose us to such large crowds at this time. Thank you.
Thank you. Our next speaker is 3343.
Hi, this is Teresa, a San Diego resident. If I might ask, where is the state of emergency? According to the CDC, the threshold for an epidemic is that it causes 7.2% of deaths. I would run the numbers, and neither San Diego nor California as a whole are meeting this epidemic threshold. Speaking of the CDC, they have a provisional death count database. From there, we see something fascinating. For the percentage of expected deaths, that is just over 100%. What does this mean? This means that about the same number of people who died last year, February through June, died this year, February through June. This makes perfect sense, considering how those most susceptible to death by COVID are the elderly and those with underlying conditions. Unfortunately, those already at death's door. As Mr. Desmond has pointed out with Dr. Hoover, this virus has a 99% recovery rate. Getting COVID is not a death sentence. If you're under 70, have no underlying health conditions, and have a healthy weight, your odds of serious illness or death by COVID are practically zero. Again, where is the state of emergency? Sadly, history tends to repeat itself. In 2001, Governor Davis had an unlawful state of emergency for 2 years. Yes, you heard me right, 2 years, until he was sued and recalled. With no end in sight, millions of San Diego citizens are miserable. And thanks to your passive consent, many more are now once again unemployed. Now, for those who don't know, at the end of this month, the extra $600 unemployment bonus runs out. What will you do if that is not extended at the federal level? Please hold more meetings in July and allow in-person attendance. If churches and restaurants can meet outside with 6 feet of separation, why can't your meetings do the same? Thank you.
Chairman Cox, that concludes public testimony on this item.
Very good. Well, since we've completed public testimony, I think what I'm going to suggest we do is we'll go ahead and deliberate on this item after we come back from our lunch break and our closed session. Since it's now, 12:50, why don't we take a 40-minute lunch break, and we'll come back at 1:30 for the closed session, and then we will reconvene at 2:30 for the completion of the discussion on item 4, and then pick up the remaining 3 items that we have, which is items 8, 12, and 17. If there's no objection to that, we will stand adjourned then for this meeting until 2:30, but the board will be in closed session at 1:30. There's no further comments. We will stand adjourned, or we will stand recessed until 2:30 for this public meeting.